Hello everyone. Welcome to the official kickoff of the EUP OHAMR, the European Partnership on One Health Antimicrobial Resistance here in Brussels, Belgium. We are happy to welcome an audience that is looking at the stream, the live stream from this event, and we will be streaming until 4:30 this afternoon with an exciting line of speakers, panel discussion, and more. My name is Anders Björk. I'm the communications manager for OHAMR, that we say for short. Happy to be here. We are going to receive an introduction in a few moments by the Director General, Katarina Bjelke, at the Swedish Research Council. So just hang on for the stream of the stream.
So good afternoon, everyone. As you heard, my name is Katarina Bjelke, and I'm Director General of the Swedish Research Council. And I'm so sorry for not being able to participate in person. But as you probably heard, we have had some problems with flights in the Nordic region and also in Brussels and elsewhere. So that's the reason why. Well, finally, after years of preparation, it's my honor to welcome those in person and those online to the launch of the European Partnership on One Health OHAMR. This new and exciting partnership with an ambitious mission is co-funded by the European Commission and aims to reduce the burden of AMR, which remains one of our top global health challenges of today's world. Building on Sweden's strong efforts to tackle antimicrobial resistance, both nationally as well as globally, and years of experience in coordinating large AMR programs, the Swedish Research Council has the privilege to coordinate this important partnership and host the OHAMR Secretariat. Aside from the role of the Swedish Research Council in coordinating this partnership, we are also the largest funder of academic-led research in Sweden, with a total budget of 8 billion Swedish crowns, which is around close to $900 million US. Funding topics range from medicine and health to engineering, social sciences, clinical studies, research infrastructure, and the arts. One of the 13 government-initiated long-term research programs in the Swedish National Research Programs on antibiotic resistance. This 10 years program, with an annual budget of 100 million Swedish crowns, aims to build systems for challenge-driven research to contribute to new knowledge and innovation. And in addition, Sweden is also renewing its national AMR strategy this year. Alongside the national research programs, the Swedish Research Council has been coordinating the joint program initiatives on AMR since actually 2013, which is coming to an end now in December 2026. And I would like to take this opportunity to thank the European Commission for their long-standing support and trust in the Swedish Research Council, right from the start of the GPI-OHAMR to the new partnership on One Health AMR. While you will hear more about the partnership later in the program, I also wanted to take the opportunity to thank all of our partners and stakeholders who have diligently worked over the years to develop this ambitious and impactful One Health program through cross-sectoral, pan-European and global collaboration. We have an exciting afternoon ahead where we will hear keynote speeches, presentations and panel discussions. While the partnership's overall aim is to reduce the burden of AMR, we will have a deep dive into the global impact of antifungal resistance, which is a key priority for OHAMR. The world is increasingly getting to grips with the impact of fungal resistance, especially perhaps those who have watched the TV series The Last of Us. In light of this, we will hear a keynote presentation from Hatim Sati, who is one of the authors of the WHO Fungal Priority Pathogen List. This will continue with an overview of the partnership and finish off with a panel discussion on the necessity of global collaboration for impact to ensure that we acknowledge and take into consideration the different contexts and realities on a global scale as we drive AMR research and innovation forward. So I wish everyone fruitful days ahead, and thank you.
Thank you so much, Katarina, for the introduction. And we also would like to thank the Flemish government for providing this venue that we are so happy to be finding ourselves in. And we've been here since yesterday, actually, doing internal meetings and businesses. So let's move on to this exciting program for the afternoon. I'm happy to introduce Ms. Kasia Jurczak, head of the unit combating diseases at DG-RDT European Commission. Welcome, Kasia, and the floor is yours.
Thank you so much. Good afternoon, everybody. And big thanks to Katarina. Sorry you could not be here, but to the great team at the Swedish Research Council for the kind introduction. And also from our side, a big dankjewel to the Flemish hosts of this meeting. Thanks for having us here. And I'm always so impressed to see how the Flemish administration buildings are so nice, unlike the Commission ones. Just a few metro stops away. So very happy to be here. And warm welcome to everybody who's online, who couldn't travel for one reason or another. I hope you can follow us online and get from your colleagues all the informal feedback from the coffee breaks. So I'm Kasia Jurczak. I'm the head of Combating Disease Unit at DG Research and Innovation at the European Commission. And I'm actually also wearing two hats today. I'm representing myself as well as our director, Pilar Aguar Fernandez, who just took up her responsibilities on the 1st of September. And unfortunately for agenda constraints, she could not be here today, but she really wanted me to say how important this file and this work is for her, because she comes from food safety, environmental health, and now working on human health. So I think she will have a very strong leader and supporter of this work and that partnership in her. And I'm here with my colleagues. Some of you met them before, but I'll give them a shout out. Alessandra Martini, Ale, stand up. Ale is the godmother of this partnership. She's been with you for months, years actually, bringing the baby to this stage. And from now on, it will be Katia Neubauer. Katia, say hello. She's the new face of the partnership. So I don't know. So the birth mother, godmother. I don't know if this is an appropriate metaphor, but the two mothers are here. And today, Alessandra is giving the baton to Katia, who will work on the partnership and on One Health approach in research and innovation more broadly. And we have quite a big Commission presence here because we have colleagues from HERA. I see Christina here, and I cannot identify, but I know there is a colleague from Agri and Sante. Yes. Hello, or they are coming. Hello, there, colleagues. So it's so important because this topic is a topic of One Health and really very much relies on the cooperation between the various sectors and government departments and research departments, right? We all live a bit in our own bubble, and the challenge is to bring it all together. And online we have also our agencies, EFSA, ECDC, and EMA. I don't know if you can do like a digital wave, but we know you're there. So that really brings me to my first point, why such partnerships funded as a strategic tool under Horizon Europe are very important for us. Not only as a tool from research and innovation, but really across the Commission, right? Because very much we see them, and in my team we have 4 of them. We have a brain partnership, we have pandemic preparedness. I see Hervé there at the back. I think That's you, Hervé? Yes. Hi, a coordinator of another partnership, the BRAIN partnership that will start an Era for Health, and your organizations as key funders are part of those partnerships. We see them really as strategic tools, the tools that address fragmentation, bring the national and European levels of investment in research innovation, and structure that research ecosystem. But I really insist on not only talking about the research world, but combining that research with the policy message. And that's why we have colleagues from our policy, from other policy departments of the commissions here, and we would like to encourage you to do the same in the context of the partnership and at national level. And you heard me speaking about the partnerships on BRAIN, on clinical research, on pandemic preparedness, because those are really the tools to tackle the most pressing challenges through collaborative research and innovation activities. And of course, we are here to address one of those pressing challenges, so improving our response against antimicrobial resistance. A work that I truly believe will bring very real effects on people's lives. And since the discovery of the first antibiotic almost 100 years ago, we've noticed a gradual decline in antibiotic discovery and development. We've noticed their overuse and misuse, and evolution of the drug resistance in pathogens that has led to the current antimicrobial resistance crisis. And that's why it has been put as a political priority. The issue of AMR is in the mission letter, so like a policy mandate of our Health and Animal Welfare Commissioner, Commissioner Varhelyi. And the president of the commission, Ursula von der Leyen, last week, or on the 10th of September, in her State of the Union address, so a big political speech she gave in the parliament, she underlined two important things for our work. One is that research is one of the most valuable global goods, right? And the freedom of research that we still have and cherish in Europe, very important. And the other message that she sent was that we are on the brink or the start of another global health crisis. And she called for Europe to step up and tackle and take the lead on global health, also in the absence of other funders that are withdrawing. And when it comes to combating AMR, and we see it very much as a puzzle in this picture of a global health challenge, global health crisis. The good news is that we are not starting from scratch, because we have already done a lot from the EU level, from national level, from regional levels. So from our side, from research programs, in the last two framework programs, that's Horizon 2020 and Horizon Europe, we have invested about 1.8 billion euro to support research and technological innovation related to AMR. We funded research to better understand transmission mechanism of antimicrobial resistance among humans and among the human, animal, and environmental sector. Again, the sectors coming together. And we have supported the development of new tools for detection, prevention, and treatment of infections, such as antibiotics and alternatives to them. So this One Health AMR partnership will make sure that Europe will play its part in building on the knowledge base for a stronger response in this global fight against AMR. And we really need Europe to play its part in actively generating the evidence needed to inform the clinical management of patients, and there are patients' representatives here with us today, and to inform the public health policies that should protect us. We also need to strengthen the One Health approach in research and innovation, as was emphasized in Choose Europe for Life Sciences strategy, so our big policy strategy guiding the work for the next 5-10 years that Commission adopted on the 2nd of July. And EU currently lacks a coherent and integrated framework for life sciences, which limits the scope for our policy alignment, cross-sector collaboration, and sustainable solutions. So we really need to bring the sectors together, break the silos, and bring the different funders, public and private, like we do in the partnerships, and different scientific communities, which we hope to do very much in the context of this partnership and the other partnerships, and connecting people like you who are experts in the field, and as well as policy and other stakeholders. So we expect that the One Health AMR partnership will take a holistic One Health approach to attain optimal health outcomes, especially taking into account the link between the health of humans, animals, plants, and our shared environment. So, ambitious task, but also a lot of partners on board. So 53 partners from 21 EU member states and 6 countries associated with Horizon Europe, as well as the United States, Switzerland, and South Africa. So that's a great effort. Really very happy to see such a broad participation. But we can and should go beyond the member states and associated countries. And we would like to see more international actors and private, whether funders or other stakeholders, innovators, engaged in this work, right? So that's really a call for action for the coming years. So the partnership is a perfect mechanism to join European forces. And you heard it, my director and us, we really believe in this partnership and have high expectations. So I'm looking forward to the discussions, to the presentations that will follow, and to seeing the results coming out of these partnerships in the years to come. So we are here to work with you and to drive this forward together. Thank you so much.
Thank you so much. Thank you so much, Kasia, for that nice speech. So we're moving on. Next item is AMR, antimicrobial resistance, setting the scene. And we're inviting, and happy to be inviting, Mr. Hatim Sati, an AMR expert, medical doctor, and public health professional. Welcome very much, Hatim, and your floor is yours.
Thank you very much. So I was asked to give a bit of a presentation about antimicrobial resistance and with special focus of a topic that is really near and dear to my heart, and that is antimicrobial resistance. First, I would like to say I have no conflict of interest to declare today. I'm joining here on my personal capacity, so the views are my own and should not be interpreted as the WHO position. I just want to start first by saying that the WHO has been really focused on antimicrobial resistance because antimicrobial resistance is the cornerstone of modern medicine. And this was reflected in the statement of the Director General, where he mentioned that the rise of antimicrobial resistance threatens this century-long medical progress. And as the WHO continues to focus on antimicrobial resistance, I want to reflect and share with you some of the latest global burden of disease study figures from 2024, where the study reported 4.7 million AMR-associated deaths and 1.1 million attributable deaths due to AMR in the year 2021. Perhaps what's most alarming about that study is that most of this burden will be shouldered by low and middle income countries. The same review projected that 8.2 million deaths are estimated or are projected into the year 2050. Most of it will again be shouldered by population-dense areas in Latin America, the Caribbean, and Africa. However, AMR is not a problem only of low and middle income countries. In Europe, AMR remains a major growing threat with tens of thousands of deaths each year and increasing pressure on health systems. And this is a landmark study. In fact, this is the first systemic and robust study estimating the regional burden of AMR by Cassini and colleagues. And in this landmark study, the researchers report that the regional burden in Europe due to AMR is comparable to the combined burden of influenza, TB, and HIV, with the highest burden among infants and elderly population. So beyond the health impact, AMR also carries substantial economic cost. According to the World Bank, drug-resistant infections could result in economic damage surpassing that of the 2008 financial crisis. The only difference is in the in the high case scenario, this is expected to wipe about 5% of the GDP in low-income countries by 2050 with no action. And unlike the 2008 financial crisis, the recovery here is expected to be non-cyclical, meaning it will be very devastating to these economies. In Europe, the European countries collectively are estimated to lose about 1.5 billion each year in healthcare expenses and productivity losses linked to drug-resistant infections. This underscores, of course, the urgent need for coordinated global action now to prevent an even longer crisis in the long run. So far, I've been talking about the burden of antibiotic or antibacterial resistance in human. And this is the part of AMR that often receives the most attention and resources. However, as you all know, AMR is broader than just bacteria and human health compartment. It also includes viruses, parasites, and fungi, and occurs across the One Health spectrum, affecting and impacting humans, animals, plants, and the environment. Fungi are particularly increasingly important part of the AMR challenge. Fungal diseases affect millions of people globally, yet their impact remains dramatically underreported and poorly defined. This neglect is reflected in the absence of a robust global estimates for the burden of disease. No comprehensive evidence and data process has yet been conducted, but despite this, we know from various studies, satellite studies, national surveys, that these infections are common, often deadly, and are increasingly resistant to treatment, particularly in vulnerable populations and in low-resource settings. And so, what makes fungi particularly of special interest is the scale of the fungal kingdom. We are dealing with a kingdom of 2 million pathogens. Out of the millions of fungal species, around 300 are currently known to infect humans. That might sound like a small number, but of course, the biological complexity, the rapid ability to adapt, the fact that fungi are eukaryotes sharing a lot of the human cell structures, and the growing resistance make them uniquely formidable foe. And so, why are so few fungi are pathogenic to human beings? Of course, the major reason is the thermal restrictions that we enjoy. Most fungi simply cannot grow at our body temperature. However, this thermal barrier, which has historically served as a key line of defense against fungal infections, is now more and more, there's more and more evidence that this line is eroding. One example is this study published in eLife by a group of scientists from Stanford, The study analyzed the over 600,000 body temperature records starting from the 1800s to present. And the study reports basically that the average body temperature has declined by roughly 0.003 degrees centigrade per decade. This is likely reflecting, of course, changes in the lifestyle. We are now living for long hours, staying for long hours indoor, living in air-conditioned facilities, and also it reflects reduction in chronic inflammatory insults as we enjoy more and more better lifestyle, which likely is driving this reduction in the core body temperature. Now, if this thermal barrier continues to shift, these real-world examples of fungal pathogenicity outside of mammals could offer a glimpse of what we could increasingly see in other hosts. At the top there you could see the chytrid fungus, which has decimated the amphibian population globally, causing widespread die-offs, frogs and other ectotherms. And in the middle, of course, as mentioned before, the so-called zombie ant, which is infected by Ophiocordyceps, a fungus that basically takes over the host's central nervous system and leverage the behavior of the host to complete its reproductive cycle. This fungal behavior inspired, of course, the premise of the famous show The Last of Us, but indeed it's firmly grounded in real biology. At the very bottom, we see Cryphonecteria parasitica. This is the cause of the chestnut blight. Basically, this fungus has virtually wiped out the American chestnut trees in the early 20th century in North America. So these are reminders of what the fungi are capable of, but under the right conditions. But really, there is no need for sensationalism. This is already happening in human health. To give you an example, let's look at the Candida species. For example, Candida are already one of the most reported hospital-acquired infections. In the United States, Candida species, hospital-acquired, was the second most common cause of hospital-associated bloodstream infections, only second to Staph aureus, most commonly associated with central line bloodstream infections in senior assisted living facilities and ICU units. And the WHO published in 2022 the first fungal priority pathogens list. The list outlined 19 pathogens. These pathogens were categorized into 3 categories: critical, medium, and high and medium rather. And they contain a range of pathogens, some of which are globally distributed, some of which are endemic to certain areas. Some are also rare molds. And here I'm going to highlight 2 of these pathogens as an example. The first pathogen is Candida auris. So before 2009, nobody has heard of Candida auris. And the first report of Candida auris was from Japan in 2009 in a patient who presented with an external ear tract infection. The physicians reported the first case of Candida auris, and in their description, what was curious is that this fungus was behaving almost like a bacteria. Fast forward today, and Candida auris is identified across 60 countries in all WHO regions, with nearly all infections becoming invasive with mortality around 40%, causing difficult to control and treat outbreaks, and posing serious challenges to healthcare systems and facilities across the board. One of the reasons this pathogen is really devastating in healthcare facilities is because Candida auris, unlike other Candida species, is unusually thermotolerant. And so when it enters a hospital environment, it's really hard to eradicate, and it can survive and thrive in higher temperature. It persists on surfaces and often is resistant to multiple antifungals, making a serious challenge for infection control in hospital worldwide. And in fact, the emergence of this fungal pathogen as a superbug with multi-drug resistant and hard to identify outbreaks has been devastated. And this was not only unexpected of a fungus, but also was a huge paradigm shift on how we view fungi and its virulence in human beings. This was just released by the European Union, drug-resistant fungus. This is the new name, Candidozemia auris, confirmed to spread rapidly in Europe. Hospitals, ECDC calls for urgent action. And in this press release, basically, the ECDC tell us that in multiple countries, this pathogen now is considered endemic, and individual outbreaks are no longer traceable and can be disrupted. So fungi also are not limited to hospitals. This is something very unique and makes them even more unique than bacteria and other pathogens. They are everywhere, causing about 80% of plant disease. And we really rely on fungicides to protect crops and for food security, of course. But the widespread of use of fungicides across the world has resulted in the selection of resistance in multiple pathogens. Particular importance to human health is Aspergillus fumigatus. It is estimated that we use anywhere between 500,000 to 1 million metric tons of fungicides globally each year. This immense environmental footprint and pressure creates a fertile ground for driving antifungal resistance. And so how is this impacting Aspergillus fumigatus? Aspergillus fumigatus, there is the causative agent of aspergillosis, and it causes a host of disease in human beings. And before the introduction of azoles in the 90s, the mortality rates due to aspergillosis was very high, and azole came in almost as a wonder drug, cutting the mortality rates and improving patients' outcomes. But thanks to the overuse of fungicides, azole, which transformed the care of aspergillosis, is now we are threatened to reverse these gains due to this drug. And this resistance is a classic case of antimicrobial resistance originating in the environment and being transmitted to humans. As clinicians now are reporting life-threatening infections in patients who have never been treated with antifungals, a clear evidence of environmental source, with two key resistant genotypes that are now directly linked to agricultural fungicide use. And so you can see today azole-resistant Aspergillus fumigatus has become a serious global One Health AMR threat. Another example is around one of the most promising new antifungals, olorofim. Olorofim is a fantastic drug that is now in stage 3 of development. In fact, the drug is, and I'm describing it as a drug, not a candidate, has been used in certain compassion cases or bases and has proven a wonder drug. It is currently a candidate for fast tracking, but it happened that it shares mechanism of action with a recently approved agricultural fungicide, underscoring the urgent need to coordinate human and environmental antifungal use to protect these limited resources. Here, the dilemma is that, of course, the threshold to bring an antifungal agent for use in human is very high, and as it should be. However, the threshold to approve a fungicide is very low, and it so happened that this, curiously, this fungicide shares the basic mechanism of action with this drug. And so the threat is, by the time this drug is in the market, cross-resistance will be already there to increase resistance to this new drug. In the face of this threat, the antifungal pipeline remains dangerously thin, with very few novel agents and slow progress against the emergence of resistance. This scarcity is due to multiple factors. Number one, the very immense scientific and financial challenge. Fungi are eukaryotes, and that they share many of the same biological pathways with the humans. That leaves very limited targets for new drug development. The clinical trials are also very costly and very hard to put together, especially recruitment of patients who are often comorbid, extremely ill, or pre-treated by other agents. And of course, there is the economic cost of development versus return on investment that has driven a lot of the investments outside of this space. The last example is a non-invasive or non-systemic fungal infection, and these are the dermatophytes. Multi-drug resistant dermatophytosis is becoming a serious problem and a major threat across the world, particularly in Southeast Asia and Western Sub-Saharan Africa, with evidence that also of spread in Latin America. A major driver for this is the injudicious use of topical, over-the-counter topical products that contains steroids. Some of these products also contain antibiotics and antifungals and are promoted as lightening agents because of the hypopigmentation side effect of steroids. They've been driving multi-drug resistant dermatophytosis in many communities. And so we are just seeing the tip of the iceberg. As I mentioned, this area is really underfunded. There are a limited number of classes of antifungals, but also the diagnostics is very limited. It is definitely an area that is limited in terms of awareness and the lack of surveillance, lack of diagnostic suspicion among doctors. And so there's a lot to learn there to turn the tide on this new threat. So as I mentioned, the WHO in response published the first fungal priority pathogens list, and come next year, we will start the update of the fungal priority pathogens list to ensure that the list is also reflecting the top priorities and continue to inform investments in this space in terms of basic research, but also research and development of new medicines and diagnostics. And we are, in terms of some of the challenges, and I was asked to touch on that, there are many challenges that are shared across AMR, including antifungal resistance, of course, bringing additional complexities, and the gap in awareness that I just referenced, the gaps in workforce capacity, surveillance, access, equitable access to the limited diagnostics and treatment access, as well as governance. A lot of the diagnostic tests are not standardized, and a lot of the treatment options also are complex and requires monitoring on application, and therefore they are not easy to administer at all levels. There are very limited antifungal drug classes. The cost is high with poor availability, especially for newer antifungals. And then there are the environmental drivers that I touched on earlier. In terms of action, the WHO has developed this framework of action to identify priority interventions to address fungal disease and antifungal resistance. This is the FPPL blueprint. It is scheduled to be released at the end of November. And in this blueprint, we identify 4 domains from as a backbone for action, and these cover public health interventions. The second priority area is focused on existing and emerging therapies and investment in R&D, as well as access and equity. The third priority area is focused on capacity building for laboratory surveillance and outbreak monitoring. And the last area is focused on the social determinants of health, climate change, and the One Health. I haven't touched on the social determinants of health, but lots of occupation, the living conditions, poverty, also the underlying immune competence of the host play a major role in some of these infections, and climate change, conflict, displacement, migration are all relevant to this problem. At the very bottom, of course, governance, accountability, and partnership are key, and a cross-cutting theme of this blueprint is innovation, research, knowledge transfer, and investment. So my last message is the key for success is the political treatment, commitment, sustained investment, innovation, equitable access to diagnostics, medicines, and prevention, and equity in the decision-making across the board and globally. Access and equity lens from a specific low and middle-income perspective is key, where there are high drug prices, there are issues with supply chain, quality of medicines, affordability, and stock outs. Diagnostics are still largely unavailable, and the lack of insurance or reimbursement mechanisms for essential antimicrobials and antifungals is still a major problem. So tools to be leveraged are there. Each partner contributes unique strength, and what we need to do is to ensure close coordination to align priorities and avoid duplication and maximize impact in a time where the resources are limited. With that, I conclude. Thank you very much for the opportunity.
Thank you so much, Hatim, for painting that dire but important and very real backdrop, and very motivating to form a partnership to curb AMR. So before we move on, we would just like to ask if there is 1 or 2 questions to Hatim. Take the opportunity. We'll see. Feels like we're okay for now. Okay?
All right.
Super. Hatim, thank you so much again. This is a small token of appreciation from us. Okay, good. Thank you so much.
Thank you.
Thank you. So, as said, very motivating for the partnership to accomplish its mission and vision. So I'm going to invite Shahida Syed, our head of Secretariat at the Swedish Research Council, and you are going to outline the partnership. The floor is yours.
Thank you. All right. Do I just... Okay. Great. All right. Thank you so much for the introduction. So just to repeat, my name is Shahida Syed, and I'm heading up the Secretariat at the Swedish Research Council for OHAMR. And I'm here today to give you essentially the overview of the partnership. Feel pretty privileged to be able to do that. I took up this role 7 months ago. I kind of still feel like a newbie, but probably past that stage now. There are colleagues both within the Secretariat as well as within the partnership who have been working tirelessly on preparation of the partnership for many years. So I feel very privileged to be able to stand here and actually tell you about the amazing program of work that has been put together and obviously then funded by the European Commission. I'm not obviously following Hatim's excellent presentation and kind of setting the scene for why we're here today. I think also anyway, many of you know why we're here today. I'm not going to dwell further on why AMR is a problem, but I did want to just capture this image and the text from our Strategic Research and Innovation Agenda, which essentially just highlights that AMR remains a problem. It's amazing that, amazingly sad, I should say, that we are still, in 2019, for instance, we have more than 1 million deaths attributable to AMR, and actually more deaths than from HIV, TB, and malaria. So we know AMR continues to be a problem, and it was really wonderful to hear Kasia's introduction to really kind of acknowledge that AMR remains a key priority for the Commission, and that research and innovation is a cornerstone to tackling that. And again, just to kind of reinforce the message of that, of course, AMR isn't just a scientific microbiological question, but it is more than that. It's a societal challenge, and we know that AMR essentially risks us achieving the Sustainable Development Goals. Of course, there's a lot of things happening in the world right now which are doing so, but AMR being one of the key global health challenges. Obviously impacting things like, everything from hunger to new drugs to economic growth and health, of course. The other thing I wanted to emphasize was the One Health aspect that, of course, is central to the partnership. We are, after all, called the One Health, the partnership on One Health AMR. We've seen this picture 1,000 times, and we've heard again from Hatim how it's all interconnected, and we really kind of need to take that holistic approach to tackling AMR, looking from the human, animal, and the environmental perspective to really understand how we can work together across sectors globally to achieve what we need to achieve, which is, of course, the reduction of the burden of AMR. The thing I just wanted to highlight here was that within the partnership, recognizing that there are other European partnerships who are also focusing on the One Health aspect, in this partnership we will be taking a human-centric approach, meaning that we will be looking at the problems from the challenges that essentially threatens human health. So a slightly different take on it, but we're putting the humans in front and center, and we're understanding how all of the other bits of animal health, environment, and so on impacts human health. the other thing I realized as I was putting this presentation together, which is pretty amazing, if you've been working in the space of AMR for a while, you will know that last year, around about this time, there was the second high-level meeting on AMR at the UN General Assembly. And so it was at this meeting where member states decided to adopt the declaration on AMR, and also agreed to, for the first time, actually set a target, which is to reduce deaths associated with bacterial antimicrobial resistance annually by 10% by 2030. So we're really set up for the challenge. So it's a pretty amazing feeling to be standing here 1 year later and actually launching one of the key mechanisms that could do something about this, that could tackle AMR, and that could provide some solutions to what we're facing here. And of course, as highlighted also by Kasia and I mentioned before, research and innovation is a cornerstone of our fight against AMR. So just a little bit of background. So OHAMR, the partnership, is very much based on a very, lost the word. It's based on a lot of experience and expertise in actually running a program such as this. And of course, I'm talking about the Joint Programming Initiative on AMR, which was also coordinated by the Swedish Research Council since 2011. So it's really been a journey from that program to go through the design phase of the partnership in 2022, to developing the strategic and research innovation agenda for OHAMR, to then actually now finally being able to launch the call. So we're building on a lot of great successes from JPIAMR, but also a lot of great learnings. And we then come to the vision and the mission of the partnership. So the vision of the partnership is pretty simple. It's to reduce the burden of AMR. Quite overarching, quite hard to reach potentially, but we think we have a way. So our mission is to boost the One Health research and innovation, essentially leading to improved surveillance of resistant pathogens, better diagnostics, effective treatments of infections and prevention measures, thereby reducing the use of antimicrobials and therefore the spread of AMR. And the partnership is very much built on four very important values. Of course, One Health being one of them. But also equality, inclusion, and diversity, recognizing that we are very much part of a global world here, and ensuring that we're not just focusing, although it being a European partnership, we're not just focusing on the problems of how Europe will tackle AMR, but actually looking beyond Europe. And there was also some very encouraging word from Kasia on that, really kind of reinforcing that global health aspect, but also things like gender aspects and gender equity. Knowledge valorization, very important. We are using research as a tool to achieve the impact that we want to achieve. That means we need to be able to translate the evidence that we're generating through this partnership. So very much focused on the impact and making sure that we're translating the evidence into policy, practice, as well as products. And then strengthening of the European research area, which of course, again, very much about building the resilience within Europe and building up the capacity within Europe, but also, again, looking broader than that and thinking about the global aspect, how we can build capacity not just in Europe, but also wider. And so the objectives of the partnership is really around enhancing European and global synergy, collaboration, and collaboration between the different One Health sectors. So again, making sure we're not working in silos. We want to break those silos. between the multiple disciplines, an alignment of strategic research and innovation on One Health AMR. We want to boost the AMR research and innovation to generate knowledge again and develop solutions to prevent and tackle AMR. And we want to facilitate knowledge valorization of research and innovation into products, policy, and practice. So very much kind of direct translation of those values into our objectives. And so just a very quick overview of the partnership then. We have actually officially started since 1st of June. We signed the grant agreement with the Commission back then, although this is our official launch. And just to mention that this is a 10-year-long project, so we have really scope and we have time to make a difference. We are, as also mentioned by Kasia, we are 53 organizations or partners within the partnership across 30 different countries, and we are very much hoping to grow that. We are very much hoping to extend our membership to also to countries beyond Europe, and this is something that we're already actively working on. So we have 250 million euros pooled funding for our research and innovation projects, and we are then hoping that through this we will generate up to 75 million euros in easy co-funding for the projects as well as for the implementation. And just to give you an impression of what 30 countries look like, I spent a long time putting this slide together. Quite proud of myself. But here we are. At some point, we shall also make sure that we have everyone's logos, but that will wait for a bit. But we're hoping that next time we come together and we show you this, there will be even more flags on this. But I think it's quite a nice slide that really demonstrates how the world is coming together to tackle a very important global health crisis. I did want to mention our strategic research and innovation agenda, which is very much what the partnership is actually built upon. So as I mentioned before, the SRIA was published in 2023 and kind of set the foundation for the scope of the partnership. Of course, the One Health approach being there, very important, being challenge-driven. We are here to solve a problem. We are funding research to solve a problem. Cross-thematic, again, bringing in the interdisciplinarity, the cross-sectoral, making sure that we are thinking about the real-world challenges. We won't have impact unless we bring in the real world and the challenges from there. And just to emphasize, again, looking from the antibacterial perspective as well as the antifungal perspective, which is slightly different from the predecessor program of JPI AMR. And so the challenges that were identified in the strategic research and innovation agenda were these three focus areas. And this is essentially what is given the foundation for the partnership. So it's around preventing the emergence and spread of AMR, strengthening the appropriate use of antimicrobials and infection prevention control, and then also providing innovative and cost-effective treatment options. And across these focus areas, we have our thematic areas, which are therapeutics, diagnostics, surveillance, transmission and evolution, and then interventions. And just to make it a little bit more complicated, we're adding on cross-cutting areas. So all the researchers who are potentially here or have dialed in, pay attention. We're also understanding the importance of not just looking at a problem from a single side. Of course, we've heard this, the interdisciplinary approach and all of that. So the cross-cutting themes, which really will be emphasized in the research that will be funded, but also the activities, is social sciences, implementation science, innovation, as well as the global aspect and the global challenges. And that has then been translated into 4 key programs. it's the Research and Innovation Funding Program, which is, of course, a very big part of what the partnership will do, which is to fund research. The Capacity Strengthening Program, really to support training, networking, collaboration across disciplines, sectors, countries, recognizing that we need to build the resilience of the AMR workforce as well, the research, I think the AMR research community is around 3,000 researchers. It's very small. And we need to make sure that we are continuously training the next generation to continue to drive the research. We have the impact program, which is all about knowledge mobilization, making sure that we facilitate the uptake of research so that we can actually implement the findings, and we can actually translate the results into products, practice, and policy. And then we have the data exploitation program, which is I have learned immensely about actually this morning because we had a session on reusable data. And this is all about promoting the fair access and sharing and reuse of data, recognizing that there is a lot of data out in the world, a lot more will be generated, and we need to make sure we're actually dealing with it in a sensible, holistic way. And these 4 programs have then been translated further into actionable work packages. And we've got 6 different work packages. And I will actually be bringing up the work package leads onto stage. We will proceed to have a panel discussion shortly. But the 6 different work packages, quite directly translated from the research programs, are the coordination and the management, which of course, as the coordinator, the Swedish Research Council will be is leading on. Then we have work package 2, which kind of ties in or connects all of the different work packages because it's all about international alignment, strategy, collaboration. And it's our DLR colleagues who are leading on that. We then have our work package 3, which is the Research and Innovation Funding Program, headed up by ANR in France. And then we've got work package 4, which is the Capacity Strengthening Program, led by the Ministry of Health in Italy. And then our data exploitation program, work package 5, headed up by ZonMV in the Netherlands. And then finally, our work package 6, which is all about the knowledge valorization, impact of the evidence generation, headed up by UKRI in the UK. And then I just wanted to give you a little bit of a sort of quick view on our governance structure, because here I think this is important to highlight that there will be opportunities for stakeholders and obviously new partners, but also non-partners to officially interact with the partnership. So our main decision-making body is the General Assembly, and this is essentially all of the members in the partnership, as well as the European Commission. So here, obviously, to be able to get a seat at the General Assembly, you need to be a partner. But then we have a range of advisory bodies, and if you're there, you're listening, you're potentially interested, this is where you should definitely pay attention. So we have the Strategic Board, which is an advisory body to give strategic advice around alignment of national and international strategies, very much kind of thinking about the more high-level aspects of driving the AMR agenda. And while we will have the member countries from the partnership, there will also be a possibility for non-member countries to actually join the strategic board, because we need to make sure that we are aligning not just within the partnership, but also outside. We will also then, of course, have a scientific advisory board. That's pretty straightforward. And then we're also setting up a stakeholder forum, which is incredibly important because this gives us the opportunity to interact, get advice from the end users, which is of course incredibly important so that to understand the needs of the end users so that we can then plan the research calls accordingly. And here, there is a possibility for interested parties to take part as we will be setting this up. And then finally, also an ethics advisory board. And this is my final slide, I think. I just wanted to give people a little bit of an idea of what we will be doing in our first year. This is a simplified version of what I showed to the General Assembly yesterday, but still captures some of the main activities that will take place. So we obviously have our kickoff now in September. We will be pulling together a finalized communication strategy at the end of October, which is incredibly important. We need to make sure that the word gets out. We're launching our first call in November, hopefully during the World Antimicrobial Awareness Week. We will be having our first annual meeting in Vienna next year in March. And then all of the work ahead for year 2 of the partnership will be planned in the annual work plan and submitted to the Commission in April. And just to say that we have just kicked off. We are very much in the setup phase at the moment. We are building the foundations of the partnership. That means we are also setting up a lot of the advisory bodies at the moment. We're drafting the rules and procedures. We are looking at potential interested organizations or experts. So again, it's a little bit of a flag to interested parties, stakeholders, organizations, countries, to potentially get in touch, because this is when things are happening. This is your chance to get involved officially with the partnership. And I do have one more slide, and this is just to flag that our first call of the partnership again, which will be announced in November. We're working very hard to finalize all the details. And this call will focus on focus area 3, which is providing innovative and cost-effective treatment options. We have an estimated budget of around 35 million euros. Please look at our website, follow us on LinkedIn, Blue Sky, to learn more about the call once it comes out. And, oh yes, I did want to just say also who we actually are. So the Secretariat is based at the Swedish Research Council in Stockholm. And we have a wonderful team of which actually everyone is here. So if you're seeing someone that you would like to speak to, then just let us know and we can direct you to that person unless you catch them at the mingle. But we're all here today to make sure that we're available should there be any questions. And then I also wanted to show the coordination unit. So this is an important function in our governance structure. We are essentially the people who are running who are managing the sort of the strategy and the kind of the operational side of the partnership. It consists of, as I mentioned before, all the work package leads, we meet on a regular basis to make sure that we are driving the program forward. And with that, I am finally done. And I want to take the opportunity to invite the work package leads up onto stage so that we can continue with the second part of this session, which is the panel discussion.
Shahida, sätter dig längst till vänster.
Okay. All right. Great. So this is a bit funny, you may think. We're here to present the partnership, yet here we are trying to have a panel discussion. Well, we thought that it would be nice not to have death by PowerPoint, so we thought it would be nice to draw out some of the detail and highlight some of the key aspects of the partnership through essentially a dynamic conversation. That is what we're doing here. So before we get into the kind of discussion part, and also just to flag that there will be an opportunity for you guys to ask questions as well towards the end, I wanted to invite all of the work package leads to give a 35-minute presentation on your work packages, just to kind of give the audience a bit of a structured understanding of what each of the work packages are intending to do. So I don't know if you need to have, yes, so, do we, yes, here. No, so it's work package 2.
Okay, we start with work package.
Yes, you start.
I have to push this button?
Yes.
Thank you. Thank you. Okay, so good afternoon. My name is Barbara Juncker, and I'm working with the DLR Project Management Agency in Germany. And this work package is led together with my colleague Akin Akuyun, who was here yesterday. And it's on strategic alignment internationally and globally and European-wise. And therefore, we have several objectives. We want to create a kind of platform to gather input for all the different work packages of the European partnership, and we want to of course avoid redundancies and to avoid fragmentation and gather input for to make a bigger use of all the results and create some common actions. Therefore, we have several tasks, which are to look for synergies with European initiatives first, maybe other partnerships or institutions or other interests. And then in the second task, of course, we want to do this globally, because we all learned that AMR is a global problem, and we have to find global solutions for that. Therefore, we are as well very interested to work together with the Global South or with LMI C countries. And then we have two different tasks. One is to be the Secretariat of the Stakeholder Forum. The Stakeholder Forum is needed to get the views of the end users and also to translate our results to the end users at the end of it all. And then we have the adoption and the development of the strategic research and innovation agenda. This is a very important tool of our partnership. It was developed before in the design CSA by Sophie and ANR and colleagues. And of course, we want to develop this further in order to update it and make the most use of it. In the next slide, you see how our work package will work together with all the other work packages. So it is obvious that we are in the middle here. And so we have, of course, reasons to collaborate with all the other work packages. We create input from partners outside and deliver that to the other work packages, but also the other way around. So with the work package on the calls, it is clear that we want to help by developing the SRIA to define topics for the calls which are important, and this is a long-term project, 10 years. So by no means we are ready with having defined topics, but this is a continuous task, and we will try together with all our partners to reach interesting topics. And then with the work package 4 on capacity strengthening, it is sure that we need to know the needs of other countries, and that we will need your input and give you as well some ideas from other partnerships and other partners in the world. then I think we learned this morning that data verification and to work with data is so important, and that we need input from you, but maybe also the other way around, that that we will provide you with the needs of all the other partners, and that we find a way to collaborate then. And the most important thing of the whole partnership is the impact we create. And at the end, it's for the end users, it's for the citizens, for all of us. And therefore, it is so important that we find a way to translate our results together with the work package 6 on impact. Thank you very much.
So perhaps we can move on with the work package 3. I can control everything. So since I can control everything, I can also control money. So this is the money work package. So this is the research and innovation funding program. So as we have heard, so it's a very important challenge, IMR, and so we need money and we need funding, so to support the researchers and the research community. And so the work package 3 is on this funding program. So the work package includes the planning of the calls, including the selection of the topics for the call based on the strategic research and innovation agenda of the partnership. Of course, there will be the organization of the calls and the monitoring of the funding activities. So inside the partnership, so we will implement 2 types of calls. The first type of call is the classical call for research and innovation projects that include also proof of concept and implementation research. And we will run 1 call every year, so for 6 years during the duration of the partnership, so during the 6 first years. And it will be composed of pre-proposal and full proposal evaluation. And we will also develop another type of call that it will be the calls to reinforce the IMR scientific community. So by networking, by create networks, by supporting networks, mobility, twinning. So it's another kind of financial support. And we will run 3 calls, a minimum of 3 calls during the partnership, 1 call every 2 years. And it will be based on full proposal evaluation. So this will not be long because I think that Shahida already mentioned you before. So we are almost ready to launch the first call of the partnership. So it will be on the focus area 3, so provide innovative and cost-effective treatment options. We will have also... okay, I broke the machine.
I think the red one, yeah.
Okay. So we will have 3 topics, including research and innovation, different disciplines, including social science, and of course, One Health perspective. So the call will be pre-announced in October, so please stay tuned. We will launch the call the 18th of November, and the deadline for pre-proposal submission will be the 2nd of February 2026. So the composition of the consortium should be a minimum of 3 partners from 3 different countries, including at least 2 European countries or associated countries, and a maximum of 6 partners, and you can go to 7 partners if you include so SME industry startups, early career scientists, or widening countries within your consortium. And so you have the list of countries on the right side. Please stay tuned. You will have more information on the website, on the newsletter, and on the social media.
So I'm Giorgio Vingiani from the Italian agency from the promotion of European research, and I think we have a video for the presentation of EP4, as I'm not the work package leader.
Good afternoon, everyone. I am Maria Jose Ruiz from the Italian Ministry of Health, and today I'll briefly present the objectives and activities of the Work Package 4, which focuses on strengthening capacity for sustainable research on One Health in antimicrobial resistance. Our aim is not only to address the gaps we face today, but also to build long-term resilience in antimicrobial resistant research. But first of all, I would like to apologize for not being present today with you. The work package is led by the Italian Ministry of Health with the support of several contributors across Europe and beyond. The strength of the work package lies in collaboration by bringing together ministries, research institutions, and supporting networks. We can ensure a wide reach and real impact. The package is structured around 5 main objectives and key components that I will show you in this slide. First, mapping needs and barriers to capacity strengthening at the global level. Second, fostering cross-sector and cross-disciplines knowledge exchange and mobility. Third, supporting career progression of early career researchers. And finally, facilitating the collaboration with national, European, and research infrastructures, and also with promoting the international collaboration, especially with underrepresented countries and low medium-income countries. All these activities together give us both a diagnostic perspective, identifying gaps, and a solution-oriented approach to bring them through the training and activities and all of them. In the following slide, I will show the task and how are distributed over time. You can see that some, like the first, the global assessment on capacity strengthening gaps, run across the entire duration of the partnership. Others, like supporting early career researchers, or enhancing cross-sector, cross-discipline and knowledge exchange, and supporting international collaboration, kicking after the first month and remain active during the 7 years of the partnership. This sequencing ensures that our early findings directly inform the activities that follow. Of course, all of these tasks will be done in strict collaboration with the Work Package 3, 5, and 6. And what we do expect for the Work Package 4 for our activities. First, we want to develop both technical and soft skills. So researchers are not only strong in science, but also in the practical and collaborative skills needed to face antimicrobial resistance challenges. Second, we aim to boost collaboration across disciplines, sectors and countries, making sure knowledge can flow freely where it's needed. First, we want to build a strong and sustainable antimicrobial resistance research community, giving a central role to early career researchers because they are the future of this field. Fourth, we will promote the global engagement, especially including widening countries and low medium income countries. This ensures that an AMR is tackled in a truly global and inclusive way. And finally, all this work will lay the foundation for future activities that specifically target the current gaps in AMR research capacity. To conclude, the work package, just to highlight that the work package is about building not just the knowledge, but also a sustainable and connected research community that can tackle AMR challenge in the long run. Thank you very much for your attention.
And just to mention that because Maria Jose can't be here today, we have Giorgio here with us today representing, he's from APRE, which is one of the participants in Work Package 4, but he's here on behalf of Maria Jose.
Yeah, so to sum it up, you already seen the main key point of Work Package 4. We are not just building, we are strengthening, we are trying to set up the way ahead, collecting fresh ideas from all the different and various key stakeholders in the field of AMR and using a One Health approach, and we will also try to not leave anyone behind, so carry with us low middle income countries and early career researchers.
Great. There's another one.
Okay, thank you. So I'm here I'm Linda van Galen from Zon en Wee. I'm work package leader for work package 5. We have a great team working on this work package. So the members are from Spain, Switzerland, Netherlands, and Bulgaria and Sweden. And they're all, well, sort of experts in this field. And we're talking about maximizing the use and reuse of research data. In that way, we will strengthen capacity. We will have to talk to stakeholders, and we will do that through the calls, and then finally we'll make best use of the results of the projects. So we're kind of, this is not a goal on its own, it's the means. How we're going to do that? So that is by verifying data and trying to help researchers how to do that. So what is the problem? Well, we have so many data sets. We sit on heaps of data, all in different sectors in the One Health, all the One Health sectors. But there's a lot of free text and there's a lack of standards. So how are we going to integrate that? We have large data volumes and they're spread over many, many repositories. How are we going to integrate that? So methods on doing your research is not harmonized. So how can you integrate research results? So the consequence is that AMR research, as it is right now, can be optimized, especially if we start with new research funded by the partnership. We can follow the guidelines, we can create guidelines, and we can optimize that the production of fair data. Well, actually, I'm going ahead of myself now. So the consequences of the things above is that AMR research can be optimized, and there's still knowledge gaps. So what did we do? We asked the partners, is there budget available for fair research data management? And 46% said, yeah, there's budget available. And then we asked, are you willing to provide the projects within the partnership with budget for fair data management? And then 48% said, yeah, we might. And then the other 48 said, yeah, we can, but we're not sure yet. And that really explains how difficult this problem is about what are we talking about when we talk about fair data management and putting money to it, put the money where the mouth is. So what we will do is actually the outcomes. I'll begin with the outcomes. We want capacity building of data stewards. So data stewardship, those are the people that it's not about the content of the data, but it is the way we handle data. So how can we improve that? We will, as you can see there, through transnational calls, and help these projects with their data stewardship and the capacity in that. And that means that in the end, the AMR specific resources, every euro we spend will be worth 2 times, 3 times, 4 times as much, because the data produced within the research is reusable and interoperable. And that is what we want. So what are we going to do? We're going to identify stakeholders together with Work Package 2 to provide expertise and the resources. We will define the needs of those end users. So what do you need for that? And what do the researchers need? We will map and catalog resources. So where is everything? What is available? And what do we need to make? together with researchers. So, and then we will develop a research data management framework for researchers to guide them on how to do it in an integrated way. We will provide training for data stewardship. And then in the end, we will have AI-driven knowledge generation using that FAIR data. That is the goal, that we have the data ready to be readable by AI. So, and then we will have improved harmonization, interoperability, reusability. We will enhance the capacity worldwide and maybe push it forward. And I think, I've said this morning, but I honestly think that it is the role of funders to nudge a movement like this. This is what we are here for. Not just to provide money for research, but also to provide money to improve the research and the outcomes. We will comply with the European Health Data Space regulations, and we will be prepared for AI-based research methods. And that's it for me for now.
Great.
Hi everyone. Those of you with keen eyes out there will see that I'm not Steve Oakeshott from the MRC. I'm Fran Hodges from Innovate UK. I'm an innovation lead for Future Medicines, and I'm here representing UKRI. Innovate UK and MRC are working together to do that on this partnership. And I just wanted to take a quick second to explain how all of that works. Disclaimer, this is not a visualization of my favorite UKRI organizations. Steve was worried it would come across that way. But what I wanted to demonstrate here is actually the holistic nature of our participation in this partnership. So I'm here from Innovate UK representing Innovate UK strategic interests. We invest public funds for economic growth, so we primarily invest in business innovation. But the MRC is representing all of our other research councils as part of our UKRI-wide Tackling Infections strategic theme. And I just wanted to demonstrate that basically the idea of One Health is embedded in our approach to delivering this work package. We've got people from biological backgrounds, environmental backgrounds, from chemical backgrounds, physics, engineering, social scientists, education, like all of those opinions are feeding into that. I have to deal with my own opinions on this partnership. Steve has to deal with everybody else's. So, but I just hope that that helps explain how UKRI is set up and how we don't mean to cause a problem in terms of our involvement. We have separate budgets, and I know that can be a bit of a pain. But yeah, this is how our organisation works. So in terms of Work Package 6, so the critical ambition for Work Package 6 is to maximise impact from AMR research and innovation investment. And we'll do this in several ways. So we will be identifying needs and opportunities from existing data, from previous partnerships. We'll be providing tools, guidance and support to our researchers and innovators. And we'll be actively disseminating outputs and outcomes and impacts for this partnership to wider communities. So, sorry, I've got too many things to hold. Within this work package, there are 4. Is that working? My hand's in the way. Working?
Oh, the top one. The top one.
Oh, sorry. Thank you. There's too many buttons on there. So yeah, we've got 4 tasks within this work package. The first task is going to be actually led by GARD-P. I was informed yesterday, not by SRC as it says on this slide. That'll be an amendment to the collaboration agreement. I hope you knew that already, Shahida. But yes, so this task within the work package will be mapping and scoping activities that will identify key gaps as well as barriers and opportunities in translating research, innovation and evidence for maximum impact. So this will help identify areas of unmet need and inform Work Package 3 activities, which will ensure that pathways to impact are closely integrated in call design at early stages. Right button again. Okay. Our second task will be to facilitate science policy implementation interface for maximum impact. So this is going to be led by ICARS. And this has two subtasks within it. So mapping research and innovation outcomes arising from JPI-AMR, this partnership, and other relevant funding programs and initiatives to identify the added value and translational potential into strategies, policies, and practice. The second subtask will be sort of starting a dialogue for implementation. So we'll be facilitating dialogue for implementation of AMR-sensitive and AMR-specific activities that have been funded by this partnership, previous partnerships, in collaboration with regional and global partners, so encompassing wider socioeconomic settings for cross-learning and knowledge exchange. Task 3, so this will be led by us at UKRI. So this task is intended to support researchers and innovators to engage with relevant knowledge users, and is again made up of 2 different subtasks. So the first subtask will include peer-to-peer learning activities, and these are intended to educate and inform researchers and innovators about the product development journey for various AMR-associated innovations, interventions, including vaccines, therapeutics, new modalities, and diagnostics. And the second subtask is brokerage events and matchmaking. So this ultimately facilitates key connections that need to be made between our different communities in different countries for research and innovators to come together and identify opportunities for them to work together as part of our partnership here. So these meetings will be run in the future in accordance with core funds, funding calls and the launch of those. And our final task will be involving the wider community to increase overall understanding of AMR threats and solutions. So this is going to be led by the European Patients Forum, and again is made up of 2 subtasks, for which there will be a platform for collaboration that will be produced, which will review best practices and identify collaboration opportunities to ensure continuity and amplification of public messaging. And the second subtask will be a platform for end users' involvement. So assess the specific needs of researchers in terms of end user involvement in AMR, with a view to developing written recommendations and guidance based on focus groups and questionnaires covering One Health sectors.
Okay, great. Okay, we need to press it back. I can do that. Oh God. Yeah, can you? Yeah, just press. I think we have. I just wanted to. Okay, this is going to take a while. So there's a pretty good picture here, which actually kind of demonstrates how we're envisaging all of the different programs and the kind of the work that has been explained here to fit together, and how we're kind of seeing them collaborate and interact with each other to be able to achieve the outcomes, the outputs that we have laid out and set out, and ultimately the impact. But I wanted to sort of continue and have a brief discussion around some of the topics that are sort of concepts or topics that are really important for the partnership, and sort of draw out some of the details that some we have heard now, but some which isn't necessarily obvious unless you read the full proposal, which you won't. So, so I kind of wanted to start with one of the kind of the major activities of the partnership, which of course is the research and innovation calls. And sort of start with the question to the panel on how do we ensure that the research calls actually do respond to the unmet need, and so ensuring that they're challenge driven, and not only kind of focus on the scientific parts, but actually reflect the societal challenge of AMR through what we've been sort of talking about here, the kind of reinforced transdisciplinary, cross-sectoral and global approach. So how do we actually make sure that it hits all these things that we've been discussing and explaining? And I'm going to direct my attention to the work package lead 3. Sophie.
Thank you. So yes, I think that so this work package is very important. This program, research and funding, research funding program, it's very important because we have seen that. So AMR is a very complex challenge, And so basically the research that we will fund should support those challenges, so the resolution of those challenges. So it's very important that basically we write and we find the proper scope for our calls so we can answer to those global challenges. So of course we have a strategic research and innovation agenda, and all our calls will be based on the strategic research and innovation agenda, but we will pay a peculiar attention on phrasing the calls so that we can clearly identify which are the challenge behind, the societal challenges behind. And as it was mentioned with the different presentation before the introductive presentation, so it's a complex challenge. So we need to have an integrated vision, and the research that will be performed by the funded project should have this integrated vision. So we will make an effort to support interdisciplinary projects, including social science, that very often they don't speak exactly the same language, perhaps as a biomedical research. So we need to find the proper way and angle so everybody can recognize itself within the calls. And also, of course, One Health. And also I think that it's important to say that we will fund both research and innovation. And again, everybody should be included, so it will not be or research or innovation. I think that the idea is really to have a continuum from research to innovation.
Yeah, no, I think that makes, that's a good description of what we're trying to do here, really kind of reinforcing, and I guess maybe also demonstrating that it is a different program from JPI AMR, which had a different set of objectives that might feel like it's what we're building on here, and we're going broader, we're going more impactful, with more ambitious with the OHAMR program. I just wanted to take a view from Giorgio on Work Package 4, because of course, on top of the research and innovation calls, we also mentioned the capacity strengthening calls.
Yeah, so actually in yesterday VP4 internal meeting, there was this recurring metaphor of towers. Like out there, it's full of high-profile microbiology researchers and professionals, each one of them like locked in their towers. But to address cross-sectoral challenges, such as One Health by definition, they need to broaden their point of view. They need to widen their towers. The boundaries of the towers. And that's what we aim to do, basically. We will try through training, through mentoring programs in order to compare different professionals and different experiences to bring them to you at their best shape. We will try to present to you the best of the best researchers that are out there, so all of them that can heighten the average level of the calls and overall, of course, the whole level of projects related to antimicrobial resistance and One Health.
And in addition to that, I just actually wanted to bring in you, Linda, because one of the things that obviously wasn't mentioned was that you're actually providing the Secretariat for this Scientific Advisory Board. And it would be good to kind of hear how we're envisaging them also playing a role into making sure that we are designing our calls in the best possible way.
Yes, well, the Scientific Advisory Board members are now, we're in the process of establishing that Scientific Advisory Board. And we aim to have members that are, on their own merits, part of that advisory board. So they are rooted very broadly in research and in AMR research, and from the Work Package 3, and we will have to ask them on their opinions, and it's not just them, because you can never completely cover every aspect of AMR within one Scientific Advisory Board. But we do need them and the Strategic Advisory Board as well to help us shape the direction of the calls. So what is important at this point? And of course, with all the other agencies in the world, other partnerships, there's a lot going on, so we need to interact with them to make sure that we fill the gaps within this partnership. But if I can add to that,
Yes,
it's
you may.
also for the work package 5, it's not just getting the right people together, it's also getting the right research in the right way, that the data they produce is interoperable. So even if you have research from behavioral science that is very different from the very, very technical biomedical science, but as long as we try to find solutions for one problem, for a big problem, which is very multidimensional. So if we are able to get the data management in a very standardized way, or at least that the researchers know what they have to do to make it interoperable, then we might get these researchers easier on board, and the result of the research will be much more integrated. So that's part of what we try to do.
Yeah, absolutely. And finally, also kind of thinking about how we can actually utilize then work package 2 in sort of the broader aim of alignment and coordination. Would be great to hear your.
Yeah, we are really not alone. We have so many partners whom we are working together, all the European partnerships, and there are so many opportunities to talk on common calls maybe, but or to avoid duplication and to find niches for all the partnerships. And then we have the national mirror groups in addition, who will really provide input of all One Health sector. So I think this is a really important opportunity of the partnership to integrate all meanings and all sectors.
And
Can I just
yeah,
add something
yeah,
from
absolutely, do
work-
come in.
Work package 6 perspective. So I think thinking about what mainly what Sophie said, the different tasks that we have within our work package will basically help find the key information that's needed for those and identifying those unmet needs, and feeding that into future funding calls, as well as actually providing a series of webinars that will basically translate for people, so people will understand what other language the different expertise are speaking, whether it's product development or social sciences, so we can start to break down those barriers, as well as the brokerage meetings where we can take the people who've been developing skills for the work package 4, they can engage with people from different countries, even within their own country, in different kinds of organisations, and facilitating those connections to make sure that we're setting up our funding calls for success.
Great. And just kind of actually picking up on those points around capacity building, obviously being a key way to actually deliver the activities that we want to do. Obviously, we had a brief but great overview from Maria Jose on this, but I just thought I'll direct that a question on how do we actually ensure that we're building a sustainable workforce and infrastructure as well that can really ensure that we have an equitable kind of global participation. We heard low middle income countries and underrepresented countries in sort of tackling AMR through research.
So I think that when we talk about all-encompassing antimicrobial resistance, we have two different problems. The first is that we consider a very huge potential plethora of different stakeholders. All of them have very different unmet needs. The second problem is that there is a lot of repetition in terms of technical expertise and instruments as well. While, for example, research infrastructures have a catalog, each of them have a catalog of services that can be fine-tailored to be applied to human models, through animal models and plant models with relatively little stress. So the idea of capacity building is to start to build all our activities in mentoring and training from a solid ground basis, with all the needs that all the different stakeholders have in one hand, and with the real technical capacity that all the partners have at their disposal right now. Starting from that, we can work on the reuse optimization, technical reuse optimization of instruments and expertises, and also build capacities that are really transferable easily through the different parts of the One Health field.
And just interesting because you mentioned also the reuse of data, and I think there's also a lot happening in Work Package 5 around capacity building. And actually, as Linda mentioned, or I think you mentioned, at least it was mentioned in the morning, it's not just capacity building of researchers, but also of funders.
Yes, because like I said, I think that if you want to make this happen, the research community is willing, but they seek guidance on how to do this and what is needed and what is out there. So I think it's the role of funding organizations together with the European Commission to make this, to nudge this movement and to nudge it into a direction. It's not that we say it should be this or it should be that. It is co-creating with researchers, but it is this data management is all about the technical part of data. So it's not the content, which is the field of the researcher, but it's more the technical approach of data. And how do we do that? How can we help the researchers to do that in a good way, in a reusable way, so that their content data is able to be reused? So we need to build capacity within the partnership, because in the partnership itself, various funders are at various levels of funding this or really grasping what their role should be. So we have to pay attention to that. Next to that, we will pay attention to the researchers, because we need their input on, okay, if we want to build repositories, if we want to build metadata schemes, you tell us what is the best way to go, because we're just trying to facilitate. We don't care one way or the other. Just choose, and then we go forward. And then there is also this data stewardship science, maybe you could call it science, which is new and which is very important, because if you want to, the end goal is that if we want to use AI, and this is going very fast, that we do need fair data and reusable data. Otherwise, it's rubbish in, rubbish out. So we're going to start with this data stewardship, so that, and reusable and accessible doesn't mean put it out there on the internet and everybody has access to it. No way. That is not what it is about. So there's a knowledge gap with people who are not data stewards on what data stewardship exactly is. So we will also pay attention to that. So it's all going to be together, because the only way as a partnership we can move this is through, like workshops or training sessions that are organized, and through the calls. This is how we can make this happen. So this is the integration of the various work packages.
And I think that is the data stewards bit is actually really interesting, because I also think that isn't there a potential plan to actually have data stewards within the potential funding organizations, as well as sort of with the researchers as well?
That remains to be seen.
Yes.
Whether we will train people, so our funding organizations are, and should they be trained? Should they be? I think for the funding organization, as well as for the partnership, it is really nice to also be at the table and say, what would we need to demonstrate our impact? How should we get your results from the research? I'm pretending you're all researchers now. So all the results, how do we want them given to us so we can demonstrate what we have done and how impactful our partnership is? So we are part of that discussion on on how do we want to manage our data that we get.
Yeah, no, I just would like to add something, I think for the work package for calls, is that so of course we will take this consideration of data and reuse of data, so we will really encourage the applicants to reuse of data. It will be written and suggested inside the call text, but I think that also we will have a work to sensibilize the researchers to, for example, existing data infrastructure, because very often they don't know it. So we will have also inside our monitoring procedure, so for example, we will organize kickoff, and the idea would be, for example, to invite some platforms to those kickoffs so they can really present who they are and how they are working, and so basically to inform and to facilitate the interaction between those structures and the researchers.
Was there any, would you want to?
Yeah, I
onto
just
that?
wanted to add that for, maybe I've said it before, I have said it before, but that was this morning, that research is actually always managing data.
Yeah.
You get your data, you manage it in a certain way, and then you get results. I mean, this is, and nobody starts from complete scratch, usually. Usually it's always based on other research. This is also something that we within the partnership promote. But it's this data management that we want to harmonize, that we want to do the researchers within the partnership in a same way, because that will take it further. Every euro spent within that research will go further than just the result of that one project. And that's something that we should all aim for as a partnership and as funders.
I'd like to add two small things. The first one is you mentioned the other partnerships activities this morning. So this would be an excellent opportunity to create synergies. Maybe we can work together with them, that our researchers visit their programs or somehow. And the other thing is that I think this, the impetus for data verification or things like that should also come from the researchers. At the moment that they notice, oh, when I present my data well and when I store them well, I have the opportunity to publish them in a better way or something like that. So if they really see it is useful for us, they will run for this and be very engaged and also enter their ideas for that.
That's the idea.
In the interest of time, I'll move us on a little bit, but actually continuing on the data aspect. I wanted to take the opportunity to highlight kind of the end user engagement aspect of the partnership, which is key. We've heard that, and obviously we have a full work package that is really focusing on impact and knowledge valorization. So I sort of wanted to direct this question to initially to Fran for work package 6. How do we maximize the impact of the research and innovation activities through the early engagement with end users? So we're thinking sort of co-creation, co-design, and all of these things.
I think in the first instance, and this is covered by our first task and sort of by second task in alignment, but actually capitalizing on knowledge that we already have from previous partnerships and looking at what was learned from there, what worked, what didn't work, and looking at those outcomes and implementing, that in what we do. I think that's really key. I think what's also really important is recognizing the differences in end users or knowledge user groups, and adapting communication strategies and engagement strategies accordingly. So, for example, this is obviously a One Health partnership, and though it's human-centric, there will be work that will be done that is focused more on livestock, for example, compared to human medicine, and the way you would talk to a healthcare professional about this would be totally different to the way you would present it to a farmer. So I think that's also really important to consider as we are carrying out all of the sort of end user engagements, and as we are supporting our projects in their work in engaging with end users. I think it's also really important to listen to and actually hear the needs that are being communicated by end user groups and those who are already working with them. And I suppose that ties back into sort of learning from what has previously been done. But a lot of the time, you know, you can have all these different workshops where people can give their opinions and things like that, and we go, oh, thank you very much, and then don't do anything with it. So we listen to them, but we don't hear them, and we don't implement, you know, what they're suggesting. So I think that's going to be really key through the work that we're doing in Work Package 6. And I'm going to give credit to Amanda Daly from our little workshop that we had yesterday afternoon, because she made a really key point, which I think is an important element, is actually identifying end user and knowledge user groups where the impact could be highest. So from previous partnerships where they perhaps haven't been engaged with as much, or the engagement hasn't been as effective, but the impact of having those connections would be really key. I think that's something that's really key to highlight for success in this partnership.
Yeah, and I mean, that's an interesting point. And I do want to get to the final question, because I can see Anders is already gearing up for the Q&A. But I just wanted to bring in quickly, Barbara. You did mention the stakeholder forum, but this is obviously a key, I think, forum for doing exactly that, sort of trying to understand who might be the stakeholders that we should maybe focus on for greatest impact.
Yeah, our partner who is the task leader, they have already a stakeholder forum, and we might identify some stakeholders which might not be in it yet, and then ask them. But it's already a big group of different interests and people and organizations, and I am sure that they will identify in the long run every expertises and people who might be needed.
Great. So just to move us on to the final question, and I mean, you may wonder why we're asking this question, seeing as we have already kind of got the tick. We've signed the grant agreement with the Commission. We are very much a One Health partnership. However, working One Health continues to be a practical challenge, and we haven't cracked it. I worked in the One Health AMR R&D space for the past 8 years, still haven't cracked it. Some of the things that Sophie mentioned here with just, you know, drafting a call text that actually reaches the different sectors and all of this. So I just wanted to quickly go around the different work package leads to kind of hear from your perspective, you know, how should we kind of proactively embed One Health from sort of the global perspective again? You know, yes, we're a European partnership, but we're in this from a global perspective. And, you know, what are the kind of challenges and also opportunities that we might face sort of with this program? I'll start with you because you're next to me.
Well, I think that if we do harmonize the way we handle data, it doesn't matter whether it's data from veterinary research on Aspergillus, or if it's from the agricultural background, or it's in the environment, or in the water, or in the human health sector. If we harmonize the way we produce those data, and how we handle them, then in the end, the research will be interoperable from the various sectors, because then it doesn't matter. So from the Work Package 5 perspective, that means that if we are going to sit together with end users saying, okay, how would you have, you know, what is important for you to get out of these data, that you don't just talk to people from the human health, but you interoperate that discussion already with people from the environmental research, from veterinary research, from water research, that are all working on these microorganism research areas, because this is what we do. And so it's evolutionarists, and so you have to integrate already at the beginning with all these people to say, okay, how are we going to connotate this type of data? And in the end, you will have interoperable data all over the One Health sectors. And this is...
It kind of gives a very practical potential solution.
Yes.
Which is what we're definitely looking for. Barbara?
Yes, we always have to think in the perspective of all sectors and all people who might be involved. For instance, the results might be so different for a farmer, for a farmer's view, or for a patient, or even for a doctor. So we have to think all about that from the beginning, and we may never stop to talk to each other and recognize all that.
Yeah, continue the dialogue. Yeah.
So for calls, I think that we have two issues. Two challenges, issues. Now, one is the fact that scientifically, so of course we need to integrate everything, but sometimes the challenges are a little bit different in one health setting compared to the other. So if you take therapeutics, for example, we need treatment in animals. For animals, we need treatments for humans. But the approaches that you will use are different because, for example, you have some antimicrobials that are restricted for human use. So you need other way of thinking in animals. So I think that this is the first challenge. So this is more a scientific challenge. And then you have a technical challenge that is specific for calls, is that I think that it was well shown by my colleague from UCRI, is that generally in funding organizations, so you have your own specificity. So you have some funding organizations that are funding human health, some funding organizations that are funding animal health. And so basically to have a true One Health approach, you need all the funders at the table. And so this is what we try to achieve, but it's not so simple. But anyway, as we mentioned earlier, so I think that the idea is really to grow up, and so to be able to have this One Health approach, so we need to have all the funders at the table.
I think from my perspective, what I think is quite key is making sure that we have we're a unified partnership, and so we need a unified, clear stance on what One Health means to this partnership. There's obviously the World Health Organization definition, the European definition, the actual definition of what One Health means. But I think in order to make sure that we have continued consistent engagement and understanding of what we are doing here across our researchers, innovators, end users, knowledge users, all of the different stakeholders that we're communicating with, there needs to be really key consistency with regards to what that means for this partnership specifically, not necessarily the organization that you represent, it's this partnership. And I think that's really important for having an impact.
Yeah, so really having a key definition of what do we actually mean by One Health?
So in terms of capacity building, I think that the biggest challenge when we talk about One Health is that there will be always some technical aspects that will be impossible to circumvent. We don't have endless hours to dedicate to training, to mentorship. There will be always microbiologists that are more expert in human pathogens, animal pathogens, plant pathogens. So it's not that we are trying to raise to the ground all the different towers, I go back to the tower metaphor, to create a unique common ground, but now we have the time, that's very important, and the resources to find the most ample common ground possible. So we are not destroying these towers, but we are creating bridges made of data, made of resource optimization. Instead of all these towers driving in this fog field, we are showing all researchers that there is a lot of stuff. I remember when, I just want to tell this, I remember when I was a PhD student and I was working on marine diatoms, and I went to this microbiology congress, and they said, what you working on? Marine diatoms. Okay, it's a bit out of field, but it's not really like that.
Yeah.
It's not really like that, because many researchers can just open their eyes a bit better and see that there are so many connections that can be done, that can be, and that can create a broader point of view on this field. And I think that this partnership is just aimed to do so.
So it's really about the broadening the view, the viewpoint of our stakeholders. Okay, I think with that, I will let Anders come on stage to start a very short Q&A. Sorry about that, but you can catch us in the coffee break. Yeah, great, thank you.
Excellent. I think we have time for one really long question, too short, so we'll see how it unfolds here. We need to take a coffee break at 3:15, so we have like 5 minutes before the next panel session. So any questions? Any short questions? There we are.
Sure. Thank you very much. Well, it's more than a question, maybe it's a reflection, and I'll try not to be too long. So my name is Teresa Chavarria. I work in the European Commission. I work in the Health Preparedness and Response Authority, HERA. Congratulations for the launch of the partnership, and congratulations also to RTD for supporting this and putting it together. So my reflection is precisely on this One Health approach you've been mentioning. I think that Dr. Hatim Sati made a beautiful example, has given us a beautiful example on this One Health approach, on trying to understand how human health is interconnected with animal and environmental health. He gave us a beautiful example with agricultural practices and the use of fungicides, now how these can contribute to the emergence and spread of drug-resistant fungi strains. So I think this is the main challenge that this partnership has. And this is ensuring all partners, all stakeholders, all organizations, including the European Commission, to understand this One Health approach. What does this mean in the field of AMR, and how we can tattoo in our skins the meaning of One Health on AMR. I think this is the biggest challenge, but as you said, you're not alone. In the European Commission, now here in this room, I have counted 4 DGs, Agri, our colleagues from Santé, RTD, and HERA. We are all working on AMR, and we are all working or trying to work with this One Health approach. So this is more a message of, we support you. We are very interested in this partnership, in the outcomes, but also in the implementation, because we are going to learn from you, and we are going to try to support you as much as we can through our work during these 10 years. I have a lot of questions, but of course we have 10 years to answer them.
We would like to have 10 years to answer that, yes.
One question per month.
Okay, thank you so much. I don't know if there's a short answer to this one, but...
No, but just to say thank you. Thank you for the support. It's really encouraging to hear that you are thinking along the same lines, because we've been throwing around the terminology of One Health for so long, and yet still we're here. Still we're facing the same challenges, and there's the token social scientist on the team of 5 microbiologists. That we don't want that. So it's really good to know that you're there to support us, and absolutely where we can support you and kind of continue to have that dialogue and brainstorm. Also together with the other partnerships, where I think we can learn and brainstorm together, move this forward together.
Perfect. I think we need a coffee break to brainstorm together. Is there another question up there? Okay. Last question before the coffee, because we need to be back in time. So that's why we're pushing this. But since we're here for the launch...
I didn't want to stop.
Yes, welcome.
I thought we had a point of view.
It's up and running.
Yeah. Hi, I'm Surbi Malhotra Kumar. My main research focus is on AMR, and I work in Belgium at the University of Antwerp. My question is related to the previous JPIMR. It was up to the national agencies to decide to participate in calls or not. The mechanism was not very clear to researchers like us. What is the deciding factor? Is it only monetary? Now in this new OHAMR, is there a role for local AMR researchers to have a say and influence decisions made by the national agencies to participate or not in calls? Thank you.
I think it's a very good point. So unfortunately, it's not mandatory for a country to invest money in a coal. So it's not possible for us to go to the president of the country and say, okay, put money inside the AMR coal. No, of course we cannot. So we try gently to convince people that it's very important, and so that they should put money in the coal. But after it's an agreement between the different countries, and also we know that a lot of countries now are facing also economic difficulties. So it's how to push the countries to continue to invest in research. So not only in AMR. So AMR is one problem, but also to invest in research in general. And here I think that the main drivers are the researchers. So this is because the researcher can mobilize, so they can go to their ministry and say, okay, I think it's a very important question, and basically I need financial support. Please invest inside the partnership. And I can assure you that we have seen when we were preparing the partnership that we have some countries that they had political hesitancies to invest money inside the partnership. And because the researchers went to their ministry, I don't want to point out any countries, but it's because the researchers went to their ministries that they convinced them to invest money. So it's our role as funders to go to our ministry, but it's also the role of the researchers to show the importance and to show the need for money. And this is how we can work together. So I think that the funders and the researchers are end-to-end, and we should work end-to-end. So to convince the political members, representatives, yeah.
The willingness, the political willingness, because I completely agree with you. So I would always say, like, for the researchers, get together with your research community and write these letters, not just to the ministry, but also to we're all in a democracy, so there's this controlling body in the government, and they have their health organization. They need to know how important it is. So that's the route to go to make ministries, because they fund the funders, basically. It's the ministries deciding whether how much money we put into that. It's not the funders. The funders always want to go ahead. So, good luck. Go.
I think we can wrap it up. But no, just to say that, we are doing our job as a partnership to push from top down, but it's really equally important to make sure that we're pushing from bottom up as well. And we all have a role to play. We have various ways to interact with the research community through the activities that will be happening here. So it's also incredibly important that you join in on all these other types of activities as well, making sure that your voice is heard. That's
Excellent. Okay, that's a wrap.
Yes, that's a wrap.
Thank you very much.
Thank you so much.
So we're going to end this session right at 4:30, just to have this amazing panel to be able to have their conversation as planned, and then we will have concluding remarks. Small note, due to travel disruptions, we are not having Madeleine Dubé-Hjalt from the Swedish Research Council as a moderator, but the very finest Shawon Lahiri, the deputy head of the Secretariat, to host this panel. And then we're going to have concluding remarks, also a little bit disrupted, but the very fine Shahida Syed, the head of Secretariat, will deliver the concluding remarks before we wrap this day and launch up. So,
Thank you, Anders. Yeah, we take it from here then. Yes. Yeah. So I don't think we need a long introduction here. Kasia already mentioned that addressing the challenges of AMR, the global challenges of AMR, demands strong coordinating actions, not only in the space of the research and innovation, but also in the policy areas, to create solutions and drive measurable impact. And in order to do so, we need cross-functional collaborations, as well as collaborations across the borders for delivering sustainable and scalable impact. And this brings to the theme of the discussion of this panel, we have a distinguished panel who would share their insights and perspectives when it comes to the challenges, the barriers, the existing barriers, definitely some successful practices for effective cooperation and collaborations when it comes to global health context. So without further ado, I just welcome the panel and request the panel to introduce themselves. We can start with Henning.
Thank you very much. Yeah, it works, right? Yeah. Thank you very much. I'm Henning Gedeke. I sit here with two hats, so to say. I'm, first of all, work for the German Federal Ministry of Research, Technology and Space. Doesn't it work?
No.
This way it's better. I cannot hear myself. So, and I sit here also as chair of the governing board of the Global Health EDCTP3 joint undertaking, which is a very long name. The EDCTP3 joint undertaking is another partnership funded by the European Union and member states since more than 20 years now, so a little bit longer than the One Health AMR partnership. And it has only two partners, the EU, represented by the European Commission, and the EDCTP Association that represents more than 40 member states from the European Union, associated countries, but especially countries from sub-Saharan Africa that are involved in this partnership. And our mission, I have to read this because it's a long sentence, is to accelerate the development of new or improved medical interventions and health technologies to identify, treat, and prevent poverty-related and neglected tropical diseases. We started with neglected diseases, and since 2021, when we were set up as a so-called joint undertaking, we also tackle AMR as one of the issues in the partnership. With this,
so good afternoon, everyone. My name is Charu Kaushic. I am the scientific director for one of the 13 institutes at Canadian Institute of Health Research. So I am here representing Canadian Institutes of Health Research as one of the partners for the new partnership. But I guess I was invited to this panel because for 3 years I served as the chair of GLOPIDAR, which is a global consortium of funders that fund pandemic research. So during the pandemic from 2020 to 2024, I served as the chair to organize the global funders in the area of pandemic research and gained a lot of insights into what it takes to put together extensive coordination activities of funders that are coming from with very different hats and from many different areas and geography and needs as well. So I think I'll elaborate on that. My job at CIHR is to provide scientific leadership and strategic insight into where we can invest within the area of infection and immunity. And just to add that I'm also an HIV researcher. So I'm a professor in medicine at McMaster University. So I also have some global health perspectives from my personal research in HIV as well.
Thank you very much. I'm Hatim Sati. And since 2016, I've been with the WHO with various capacities in the AMR program, starting as a technical officer at the Latin America and the Caribbean office in Washington, D.C. And since 2020, I have joined the WHO HQ as a technical officer leading a priority setting for R&D and public health. My background, I'm a physician by background. I'm a public health physician. And our work focuses mostly in, of course, building capacity, providing norms, standards, and tools, and try to guide investments in public health and R&D for the prevention and control of antimicrobial resistance. I'm currently in a short hiatus, as I mentioned earlier, but we'll be back to the WHO on the 6th of October, where I'll be also working from this point on, in addition to my portfolio, on access, equitable access to antimicrobial medicines.
Good afternoon. My name is Louise Norton-Smith, and I'm Director of External Affairs at CARBEX.
And we are delighted to be, I think, the only, at the moment, US-based partner in the OHAMR partnership. So as you can hear, I'm not American. I'm from the UK, and I joined CARB-X last December, having been in the UK government for 12 years. So CARB-X is, for those of you who don't know, it's, whilst we're hosted at Boston University in Massachusetts, it's actually a multilateral or multinational non-profit partnership. So we have 6 governments and 3 global health philanthropic organizations who fund us, hopefully soon to be 10 funders. And together they set the strategic direction of the organization, which ultimately funds and supports through non-financial support product developers who have innovative vaccines, therapeutics and diagnostics against antibacterial threats. So it's only antibacterial, sorry, Hatim. But we have, over the last 10 years, funded over 120 projects now to advance through the pipeline. So my background is not scientific. I'm a social scientist with a development and a bit of public health thrown in. So I bring a slightly different perspective to the party.
Thank you. Good afternoon. My name is Helle Kraub, and I'm the Director of Operations in ICARS. And ICARS stands for the International Center for AMR Solutions. For the past 5.5 years, I've been heading the build-up of this new organization, the organizational development. And this was an initiative that was taken by the Danish government with a view to partner with low and middle income country governments and research institutions to develop and test AMR solutions which are tailored to their realities. That is, that they are context specific, and we also aim for them to be cost effective. So our aim is really to bridge the science, policy and practice interface by bringing together LMIC ministries and researchers, as well as clinicians, practitioners and farmers. We work across the One Health spectrum to test and develop AMR solutions which are based then on national priorities. And this is really important for us. We go into a co-development process with the countries. So basically we don't do calls, but we work based on expressions of interest from the countries, and then work together based on that to co-develop the project. And then we provide both the funding and the technical support, both during co-development and implementation of the research project. So basically what we would like to do is to do research that will lead to change on the ground. We use the term intervention and implementation research. In terms of the prevention and control of infections, the use of antimicrobials, and the mitigation of AMR in all One Health sectors. So it can also be biosecurity, use of vaccines in the farming sector.
Thank you all for being part of the panel today. Maybe I can just start with you, Henning. Given your role as the chair of the joint undertaking partnership EDCTP3, can you share with us some of your experiences when how to align effectively the common goals and the visions, the shared visions that we have? You mentioned about AMR being in the portfolio also of EDCTP3. Can you share some of your experiences from your the partnership?
Yes, thank you. Now you can hear me? Because it sounds, yeah. Better. Yes, I mean, we are a big group big group of member states when it comes to defining to shared goals, but first of all, I would say it's very important the work that is done by the WHO, because sometimes we were joking about WHO is a little bit dysfunctional, but the guidelines that the WHO gives, starting with a list of neglected tropical diseases, because we have a strong focus on neglected tropical diseases. And if you look in the strategic research innovation agenda, you see that we go by this neglected tropical diseases. We cannot tackle all of them, so we have to do priorities within the priorities. But of course, just like the One Health AMR partnership that works with the WHO list for bacterials and fungi, we do the same as well. And it's this is an important factor because in WHO, it's not an organization that's somewhere in Geneva like a spaceship, but it's 192 members, or 2 are missing soon, but so 190 members soon that came up, you know, with this common goal. So we don't start from zero. And then when it comes to alignment, to go a little bit more into the details, then when it comes to calls, we have a strong involvement. First of all, it's a lot about trust that was built within the past 20 years, which is very important, and it shows that you need a long time to set up these kind of partnerships, especially with partners with very different backgrounds, and also within Europe we have different perspectives, and then of course we have the language barriers within Africa with the Lusophone, Francophone and Anglophone countries, but we work together for a long time, and we do have partners from Sub-Saharan Africa, from the European Commission, from Europe involved in the governing board that then finally decides, for example, on the work program. But we do get a lot of input while this work program is drafted. First of all, from our members, so all members do have a say. We do every year 2 very long discussions in the General Assembly where we discuss the calls that we have for the following year. Then we have a stakeholders group, of course, where both perspectives, also from EU and Sub-Saharan Africa, involved, and we do have a scientific committee where we also have scientists from actually all over the world. So I think this is a very important factor. And then I would say it's not only the WHO, but finding common goals and finding common strategies is a lot easier when you have the political background. And I think when it comes to the One Health AMR partnership, this partnership starts with a lot of political pushing, because we mentioned the UN declaration last year, but we have G7, G20, and in the ministry I'm also involved in these processes. AMR is every year on the agenda of G7 and G20. This is not true for many other fields, so we are quite privileged there. And then we have the pandemic treaty that was agreed on, not adopted, not ratified yet, but agreed on in May. And AMR is explicitly mentioned, and One Health is explicitly mentioned. So there's a lot to start from.
So there's a lot of push in the political engagement there. So that's good to hear. That's encouraging to hear for this audience, probably. Yeah. But since you touched upon WHO, maybe I can just jump on to Hatim. During your presentation, you just touched a little bit on the equity in decision making, and also equitable access to diagnostics, medicines, and preventatives. So could you share or reflect on how, during your experience or in your experience as the technical expert in WHO, what has been the broader role of global coordination and collaboration while tackling AMR?
Well, thank you very much. First, you mentioned many words that I like. Common ground, trust. These are key words for partnership, I think. But also, as you mentioned, I touched on equity, having seat in the table, being heard. I think we sometimes make the mistake of speaking to each other and not reaching out to the communities that are vulnerable in the places in the field, populations that are touched by these problems. And I think that is a key, is to be as inclusive as possible and to try to understand the other's point of view, barriers also. A lot of times also we kind of have this tendency of building projects and proposals that are eventually distant to shelves, if you don't understand the context and the ground. So I think this is key. And then in terms of what was mentioned about the WHO, I think this is also the beauty of the diversity among these partnerships. Each of the players have a strength, and if we truly define common ground and have trust with each other, each of these unique features of each partner can be leveraged, whether it's the convening power of the WHO or public-private partnerships, funding mechanisms, or even satellite researchers who are proposing R&D early or late stage, or even capacity building activities in the country. Yeah.
Thank you. Charu, I come back to you related to the global collaboration of funders you mentioned and your experience and in the GloPID-R. Just share with us what you have experienced, if you have experienced the barriers for effective collaboration, and what were the challenges there?
Yeah, so just to set perspective that, when so I'm going to put this in the context of COVID, but again, it's really encouraging to hear what Henning had to say, what you had to say from WHO perspective, because some of what you mentioned resonates very well here, what didn't used to work and what worked. So the imperative was the COVID-19 pandemic, which was required people to coordinate. But I remember going to Geneva on February 17th of 2020, where we had the global discussion from multiple countries on what was the research agenda that needed to be done. And basically the funders that were there, met separately, and basically everybody said to everybody else, good luck figuring out what your country will do in this, because there was no agreement on common ground of how we could coordinate. And then over next few months, the imperative, because this was a global issue, just like AMR is, there was recognition and agreement that we needed to find common ground. So in discussions, some of the words that were mentioned here, building relationships, trust relationships. So what worked best was where there were already pre-existing trust relationships, which you could leverage, because when people said something, people could trust them to sort of say, they will deliver because we worked together before. And I wrote these down because this comes up over and over. The second part was lowering the barrier for participation. It's really important to understand what are the common grounds, not just come with your own agenda of, we need to do this, or we need this from you. And I heard that, what are the bottoms-up priorities, and where can we find some common principles and grounds? And then the third part is lowering the barrier for participation. Not coming with, you have to be a funding partner, you have to have this much money, you have to do this. What is the common ground, and how can we lower the barrier for participation? So during COVID, for example, countries from the global south who were not able to participate with funding money, et cetera, and it was clear when we did the analysis, probably 8 months into it, that majority of the funding was going to the global north, not to the global south. And everybody heard the term of, we are not past this pandemic unless the whole world is participating. It's a global problem. It's just the same. So I'm drawing parallels between AMR and COVID. Absolutely. So it was clear that work needed to be done in the global south. And you can't go to global south and say, so where is the investment in funding research? So the common ground was, what did they bring to the table? And finding that to sort of say, and yes, we have funding and partnerships here. What is your priorities, and where would you like to invest money? So I think that's a really key in terms of building trust relationships, being willing to hear what people are asking for, and lowering the barrier for participation.
Taking into the context or the perspectives from the different countries in the global south into consideration when we are building this partnership.
Absolutely.
Right,
so that's why even yesterday when we were talking about stakeholders, I was reminding ourselves that, again, because this is a European partnership, I was very encouraged to hear the representatives from the Commission talk about global partnerships, because again, AMR is it's a wicked problem. that needs global participation. So this may be a European partnership. Countries like Canada and Japan and Korea might join it, but we are not done until we have places which are underrepresented, where we saw the numbers today. Majority of the people who are being affected are really in the LMIC.
Thanks for sharing that perspective. Coming to you, Luis, we heard also from Kasia earlier in the afternoon, there is a strong emphasis now also for the engagement of the innovators. And you, from Carvix, being in this innovation space, how easy actually it is to identify and engage with the potential collaborators, not only government, academia, but also the private sector. So any reflections?
Yeah, so we all work in, and you mentioned it, Hatim, earlier, about working in silos, and we tend to stay in our ecosystem. You know, we come to lovely meetings like this and catch up with colleagues and friends. But it's really about trying to break out of those silos. And I think one of the most important messages that I think I've probably got for the partnership as we kick off is around how we tailor the messages to fit the audience that we want to attract into the conversation. So in terms of the relevance to the private sector, for example, first of all, the private sector is huge. So which bit of the private sector? Is it the small and medium enterprises who are working across the European or the European Union or wider than that? Or is it the big pharmaceutical companies that are still in the AMR space? So really trying to pin it down and work out what out of the work packages activities, what is relevant to them, and how do we effectively sell their role, what we want them to do, and bring them in that way. And I would say the same for the wider academic community that might not necessarily be immediate participants in the grant calls. So thinking about the sorts of departments that might not traditionally apply to broaden that base. So whether it's the social scientists or whether it's, I mean, we had a really interesting training program in the UK where we ended up having architects involved in transdisciplinary calls. And the perspective that they brought from the built environment on how we address AMR, both in hospitals and in home settings. So I think it's about also being creative and challenging ourselves to think beyond the kind of the usual suspects, I guess. And that also stretches to patient groups. I think, you know, we always lament the idea that we don't have a face of AMR, but there are so many patient groups who represent the types of illness that really disproportionately affected by drug-resistant infections. I mean, the cystic fibrosis community, the cancer community now with the amazing work that UICC has been doing. So I think really thinking outside of that box and using the networks, because our networks are not just AMR. Our professional networks might be, but our personal networks might be wider. And there's always, I don't know, the conversations that I've had with people who have nothing to do with AMR, but who are interested when you actually have that conversation and who show curiosity. I think it's really on us. We have the responsibility to be the spokespeople for the community. So yeah, that's how I would suggest it's really on us, I think, the responsibility, and that comes with tailoring the message so that we think that we can attract different voices to the room.
To reach out to the wider community,
Exactly.
You mean to say, yeah. Just to highlight here that we are looking forward our work within the realm of the partnership along with the European Patients Forum, who are also a part of the partners in here. So we hope we will be extending work in that space as well. But yeah, now to Hele. We mentioned about sustainable impact, and we also have been talking about global collaborations. Do you really see how only global collaboration will actually be able to drive the change? Or, like you mentioned, what ICA's mission has been, it has been also tackling the problems at the grassroots, right? So how do you drive such grassroots impact and then scaling of solutions or community solutions to create a long-term impact.
Thank you. I think important words have already been said here. The word trust, evidently, equal partnerships, common priorities, and lowering the barrier for participation. I think those were all really important and very clear points. I would like to add to that local ownership, which is really why in our work it's so important to focus on the national priorities, engaging directly also with the policy level to ensure that once the solutions are developed, that in fact there is a willingness to take them up. Also recognizing, of course, that we cannot look behind the private sector and civil society, as already as mentioned. We work also in the One Health, across the One Health spectrum. So if you are working in farms, well, that is basically civil society, right? And private sector. So I think in terms of lowering the barrier that was mentioned here, it's also important to work on strengthening the research capacity. We need to not only come with some funding, but there's also sometimes a need for the technical support to the local research teams, and that's also to really create this lasting impact. And then I think it's been said many times, but getting beyond this siloed approach, in fact, we ought to get to the point where AMR is a natural priorities in areas like cancer treatment, IPC WASH, that it is actually mainstreamed. And I know that it's almost been said so many times now that it sounds like a given, but that is actually what we need, I believe, to get to a sort of true sustainability. Now, in terms of the concrete research projects, in fact, we are right now together with research teams in Nigeria and Ghana. This is funded by Wellcome, in the process of developing a comprehensive sustainable impact resource guide. So really trying to look at what are the barriers and enablers that you can look at from day one, because I think that's actually the important point here, that sort of sustainability and uptake cannot be an add-on once the project is sort of moving towards finalization. This is something you need to think about from day one. And of course, once this resource is ready, it will be open for everybody to use. And we will also, of course, bring that experience into this partnership. So from ICAR's side, I think our hope for this partnership is really that also when thinking about maybe some of the experiences from the JPIMR, which everything here is building on, that we can move a little bit further towards the actual uptake of the solutions and sort of a little bit further towards the implementation phase.
Yeah, Shahida presented that we will be having a strong focus also on the implementation aspects within the realms of the partnership. I mentioned about that we will not be only talking about the challenges and the barriers, but we'll also like to highlight some of the successful practices. So to each of you, could you please share any personal experience in the scope of the work or the experience that you have over the last decade probably, or a case where global collaboration actually led to a tangible outcome? I mean, to say what made that collaboration successful, or what lessons did it leave with you? Henning.
Well, I must say my favorite part of the General Assemblies of EDCTP is when Michael Makanga, our executive director, presents the success stories. So this is really, it's a lot of work that comes additionally to my normal work, but this is really when you see what's the outcome. A lot of these successes, of course, were started long before I started working with EDCTP 4 years ago. And but I looked at the website before, and there's, for example, the first ever malaria vaccines were funded by EDCTP. Not only by EDCTP, you all know that in the field of global health we have a lot of funders, but some of the clinical trials were funded by EDCTP. The first oral treatment of an acute form of sleeping sickness, and the third would be the first pediatric formulation for treating multiple episodes of malaria. So these are really results where you see a concrete outcome, where there was a discussion where should we give the money, and the money was funded to given to these clinical trials, and these are really outcomes that make a concrete difference. And one third of the projects actually that EDCTP is funding since 2021 has also not only focus, but has also AMR involved. So I think it's 33 out of 110 projects. So I'm really looking forward to seeing the results of this then in one of the following General Assemblies within the next years. So
Keep us posted. Charu.
That's really encouraging to hear. I guess I'll give an example of what, and I'm really glad that you brought up the local priorities, because when GLOPEDAR was struggling to figure out how to be inclusive of the Global South, 12,000 of the grants that we mapped, actually 9,800 were in the Global North. Less than 3,000, and if you divide it by money, it was even less. So it was clear that we needed to bring people on board, but we had no trusting relationships. There was no previous mechanism to work with them. So it was really puzzling on how to go about doing that. And the breakthrough came because when we were holding meetings, and WHO was part of that, we would hold situational updates on COVID every 2 weeks, and we had over 110 countries that would join that call. And we had outreach from South Korea to say that we are really worried, when things were getting a little bit under control, that the next outbreak will happen in this area, in this region of the world, and we have no coalition here to do any kind of surveillance or any work that can be done here. We'd like to work with GLOPEDAR to actually put together a regional network. So that was really amazing, because we knew that we had to make that kind of breakthrough. So we worked very closely with South Korea and other partners that they had put together. They needed the GLOPEDAR consortium to really have that outreach, but they wanted to have their own self-determined priorities. So they brought the partners in the region together, had a couple of series of meetings to understand what the regional priorities were. And then we basically replicated that exact mechanism in Africa. So we put out solicited and said, who would like to have a regional node in the African subcontinent, to be able to do this kind of work and coordinate globally. And it was an open invitation, and South Africa put up their hand. And they basically ended up bringing their networks and their meetings together to sort of say, what are the priorities for the African continent in this area? And then the third partnership was going to be in South America, and Brazil put up their hand to say, we would like to do this. They were waiting for their political climate to be more, forgiving in terms of the work that they wanted to do that. So that actually worked out really well, where there were, and the regional priorities were different. In different areas. So it's really important to hear ground up what their priorities are, and then there's so much investment in that because this is being done regionally. So I really like that example because it was literally hundreds of hours of phone calls and being on the phone and talking to people and encouraging them. But the result was really, really successful. And to me, the key success was that when I left as the chair of GLOPEDAR from Canada, South Africa has taken up the chair of GLOPEDAR. So they are coordinating internationally, what the pandemic preparedness should look like.
That's excellent.
Yeah, that was really beautiful. Yes. Now, if I have to think of, and there are many examples, when I think I'm privileged because when we work in the WHO, we have also access to a lot of partners and fantastic collaborators. But I had the privilege of working on the first WHO fungal priority pathogens list. And the development of the list itself involved so many partners and so many experts. Almost all the societies across the world, regional, national societies participated, local partners, and scientists volunteering their time in appraisal of evidence to inform the process, the decision analyses, and informing the criteria also of the ranking of the pathogens. And when it's all said and done, there was 600 people involved in this project. And it was truly a collective, and what that has created is an automatic endorsement of the piece before even it was published, because it created this ownership of the product. And it's reflected even in the list. The list has globally distributed pathogens that are relevant to a lot of places, but also endemic pathogens, coccidiomycosis, endemic to North America and Central America, paracocci, endemic mostly to Brazil, Telleromyces is a problem of Thailand and some places in Vietnam, but and even rare molds like Lemmentospora prolificans found a place. And so as a result, the collective, which was our main readership, our main target audience, the researchers, the investors, had this list that is really balanced, and therefore investment could be informed truly based on a global approach. In the back end as well, there was something beautiful that happened, because this project started with generous funding from the government of Germany, the government of Austria, and the government of the United States. But halfway through, due to funding restrictions, etc., the dissemination process was interrupted. And of course, our dear colleagues in HERA, EU, generously jumped in and picked up where the rest left off. And this is why this list is now the build-up or the framework, the blueprint and update of the list is possible. So this is one example I could think of there.
Needless to mention, the priority pathogen lists are also guiding tool for us throughout the JPMR days, as well as for the One Health AMR partnership. Louise, please.
Yeah, thank you. So I think the kind of key for me is a policy decision that I made in my old job that's now affecting me in my new job. And that's where we made the decision, and in fact, Shahida was involved in that decision as well. She makes good decisions, generally. When the Global AMR Innovation Fund decided that we would invest development funding into CARB-X, which had been set up, albeit with a global health angle with the Wellcome Trust, but also to be very traditional in its approach, I think it's fair to say. It wasn't part of the global health community. And so we had to make the case that we thought it was important that aid funding should be put into this drug development project, multi-million-dollar drug development project, so that we could have an influence on the products that were coming through and tailoring them to the sorts of patients who are disproportionately affected by AMR, who don't typically live in countries that are the first port of call for pharmaceutical companies. And so that decision in and of itself was quite a brave one, I think, on behalf of the UK government to take that. And it then led to a real coalition working together to figure out how we could then take this machinery and try and alter it so that it could serve dual markets. It could serve the traditional big pharma market, and it could serve the needs of LMIC countries. And of course, within that, you don't have one single voice. You have all sorts of different markets within LMIC settings. So I think having a coalition, including the pharmaceutical companies and the representatives, as well as non-profit organisations like Access to Medicine Foundation, along with GARD-P, and I think there are several others as well, we came together and we wrote the first ever stewardship and access plan for product developers in early stage innovation. And this is often an area of science where you've got small and medium enterprises. Sometimes they're spin-offs of universities, sometimes they are maybe little units of big pharma companies that have been sold off or spun out. And often there are only very few people in those groups. and they don't necessarily have a global health background. They might be incredibly clever scientists. They're doing their science in their corner. They're not necessarily thinking about what if their product was ever successful, and to go through all of those barriers, what would happen if it does reach the market, if they manage to get registered, get approved, and then be in a position to be sold and used. So I think actually trying to get a coalition of the willing effectively to think about how do we take these product developers with us who don't necessarily have the skills, not for want of trying, but it's just not in their bucket, and work together so that we can create an infrastructure around them so that if and when that product is successful, it's in a really good place to be picked up by another global funder, for example. So I think, again, it comes back to what I was saying previously, a coalition that isn't necessarily a natural fit, but coming together to work on a common problem means that now we have an infrastructure around Carbex that isn't just for patients in Brussels or in Boston or in London. It will be ultimately for patients in Bangalore or in I don't know, wherever really,
any other parts of the world.
all sorts of places, and there are markets there, and I think that's where again with Gamma, if we brought in Chai, I know we've got Chai colleagues in the room to help broker that. They were an honest broker where they could say, look, this is how you can create markets. You might not necessarily think that they're traditional for you, but the need is there and there will be a willingness to pay. It's about trying to come at it from both angles. How much is the economic benefit? How much is the willingness to pay? And then how much can we get those products down to fit that need?
So you've created a great support system through the entire stages.
Exactly.
To bring the product into market. Heli.
Yes, thank you. So ICARS is still a fairly sort of new invention. So in that sense, we're only starting to see the first results coming out now. So in terms of sort of personal impact story, I would say that sort of having been part of that journey over the past 5 years and getting to the point where actually we have more than 50 projects in more than 25 countries now, is in itself has been sort of a pretty wild journey. But just to mention some of the initial results that we are seeing coming out, what I want to say is actually that behavior change is possible. And I think that's actually really important to state because while hearing and talking about these issues, sometimes you almost sort of lose faith that it's actually possible. So just mentioning 2 concrete examples, a project we have done in Georgia on surgical antibiotic prophylaxis on adherence to guidelines has actually had really positive results, and at the end has ended up informing national policies. So adherence to guidelines has actually been taken up in their national action plan. Another example in the veterinary sector, production of pork in Colombia, where the use of improved provision of colostrum and vaccination actually led to a decrease in the use of antibiotic feed by more than 90%. And that was together with a better health for the animals as well as a weight gain. So it is possible. And I think that's very important to say at the start of a new partnership like this one. And then one final thing, I think, working with low and middle income countries, one of the really encouraging things to see is when we bring together the researchers that we are supporting in our projects. So we did this just before the summer in all of our African projects, and seeing how much they appreciate coming together with people who share their passion, and maybe sometimes they sit a bit alone at home, but to see how much that can then also sort of build them up, and all of these collaborations that are starting across countries, and really sharing learnings, experiences, and so on. I think that was also one of the most encouraging things to see. So I really think that there is a lot to build on, and that's important to remember at the start of this new initiative, I think.
Surely. Thanks. Thanks for sharing all your insights. I'm looking at Anders. I don't know if we will have the time to take any questions from the audience or not, or maybe one burning.
That's a good question. We find ourselves at the same point as for the previous. If we have two short or one long question, I think we have to fit it in because just to honor the panel. So I don't know if there's anyone who have something on your mind. Then the moment is yours. Before we go into the final remarks of this amazing kickoff. The silence.
Yeah.
The silence.
So the take-home message for me, or what I heard from you, if there's no single solution and there's no single recipe, so the words that I picked up are building relationship, building trust to strengthen the relationship, lowering the barriers for participation, coming down to common principles and grounds to collaborate further, being heard, like you have mentioned, Hatim, also having the seat in the process of the decision making, and like you mentioned, Louise, reaching out to the audience and tailor-made the messages so that it's communicable and understandable for each other. So I think that sums up. Probably these are the aspects that we have to take into consideration. Kasia, yes. I'm sorry, I missed your hand.
I was being shy because I didn't want to monopolize the floor, but since
you're very welcome.
Everybody else was shy as well, then I grabbed the mic. I wanted to say that I really thoroughly enjoyed that panel and listening to you, and it made me reflect on how we have to think strategically about the many tools that we have, that we are investing in from the side of the Commission. Let it be the EDCTP, let it be GLOPIDAR, let it be other partnerships, whether it's pandemic preparedness, that all have an angle to cooperate with and to enrich the work of the One Health AMR partnership. So in your panel, very clearly, it showed the points of connection between those initiatives. So we take it also as a message back home to our offices to look at okay, there is a package on international cooperation, but also more than that, how from the boards of EDCTP, from the boards of GLOPIDAR, from the AMR Global Hub, RNI Global Hub, we can really work on those synergies. And I really also took note of the point the speaker from Carbex, a representative, made, when we speak about private sector, and perhaps in the Commission we have this tendency because this is a way for us to change the way we fund research and innovation, right? To go from grant funding to more blended finance. So when we say we really have to be sensitive to the types of new audiences we are engaging with, whether it's multilateral banks, whether it's charitable foundation, but whether it's also the startup scale-up spin-offs from universities, right? That we would like to cooperate with more, and we need to look at our discourse and those channels for engagement. So that's a message for all of our partnerships that we fund and us as a funder as well. So I really thank you very much for this great discussion.
Thank you.
And with that, we join hands to applaud the panel for such an enriching discussion.
Exactly. Excellent. Thank you, Shawon. Amazing moderating. So now is the time before we are going to have a mingle, if you're here, we hand over to the final remarks, the concluding, to Shahida.
Great. Okay. Again, due to travel disruptions, I'm stepping in to do the final remarks, but pretty happy to do so. I'll be quick. I just wanted to start with saying that it's been a fantastic 2 days. It's amazing to realize that our partners have legs. So that's always good to know. To actually see people in person and just be able to realize that there is a person behind that email address. I think I was trying to sort of summarize 3 key points, kind of 3 takeaways. So I think sort of from my perspective, I mean, we all know this. Evidence creates impact. We know that. But I think what we need to appreciate is that whilst we have an important challenge ahead with AMR, we actually just today have launched a really ambitious tool to really rise to that challenge. We will continue with OHAMR to put research and innovation in front and center in our fight against AMR. And also what we learned today, and what I have learned so much about reuse of data, is that we really need to make sure that as we're creating the evidence, generating the evidence, that we're taking a conscious approach to how we deal with that data. It's what is going to make it sustainable, and it's what's going to generate the impact that we're looking for. The second key message is One Health is hard, but actually it turns out that we might have some solutions. I think we heard from the OHAMR kind of overview session that, you know, within the partnership, we are really thinking about this, and we're really thinking about the tangible solutions that we can trial, put forward to really kind of transcend the challenge of One Health. And it's also really encouraging, as I mentioned on the panel as well, to know that, in fact, others, such as the European Commission, are thinking along the same lines. So we're in this together, we're going to explore, and we're going to really drive that One Health agenda forward together. And finally, just from the panel just now, common ground and trust is key for a successful and a sustainable collaboration. And I mean, it's true. I absolutely agree with that. And I would just say, as a practical example, is that, you know, despite all the travel disruptions and whatnot, and it being a very busy month for many, so many people and so many of our partners and stakeholders decided to join us here in person today. I think the in-person aspect is really key to kind of start building that common ground, to brainstorm together, to have conversations, to challenge, to question each other, but also to then actually move forward from that. And as I said, find that common ground. So in-person meetings are key, and it's really appreciated that everyone who were able to come here and join us despite disruptions did so. I have to also acknowledge that, of course, it doesn't mean that you can't achieve things virtually. We have all done that during the pandemic, but I think it's still nice to know that, or it's still important to know that what you can achieve when you come together can sometimes be incredibly powerful. And so with that, there are a few people or a few organizations that I'd like to thank. So of course, thanking the European Commission for, you know, having the trust in the partnership and signing the grant agreement, great. Specifically thanking Alessandra, and of course looking forward to working with Kasia, and then of course Andres, who hopefully is watching this. And also great to have met you, Kasia, and that you came here to do a welcome remark. I think that was a really important presentation for us to understand the kind of the wider picture. I'd like to thank all the speakers and of course the panel members for traveling here, for joining us and sharing your thoughts, experiences and knowledge. I'd like to thank the Flemish government. I hope it's the Flemish government and not a different word, for the venue. That's the main point. I'd like to thank the Secretariat as well as Toon for all the organization of the kickoff. It's been a massive undertaking in a very short amount of time. And of course, I'd like to thank all the partners who made the effort to come here. As I said, really looking forward to working with you guys for the next 10 years. We're stuck with each other. And then, of course, to our stakeholders who joined us for this external launch of the partnership, as well as our participants online. So thank you so much. I've really thoroughly enjoyed these past 2 days. And with that, I wish you all safe travel back home. Thank you.